D.
K-Man's top news headlines of the day from CMR.
Brought to you exclusively on Kiss FM by J. Michael Fashion for everyone. Good morning, Sandy.
Hello.
Good morning, Blake and Aaron. How are you guys doing this beautiful Wednesday morning?
Yeah, we are great.
Good.
What do you got for us?
Fantastic. So we have an arrest and a charge laid against a man by the name of Richard Scott, age 27, of Georgetown, meaning he resides in the beautiful district of Georgetown. In fact, we know he resides on Crew Road. He has been charged with the robbery, attempted robbery, and possession of an unlicensed firearm with intent to commit robbery in relation to the Scotiabank incident on Friday.
Get out of here. Really?
Yeah. Wow. That's right. We got his name, his picture, everything.
Wow.
And the backstory. That's
you have this picture you can show us?
Yes.
Let's see.
Hold on. Let me get it for you.
So he's a local Canadian?
Nope. Jamaican national.
Jamaican national. Okay.
Yeah. His mom lives there off of Palmdale. And interestingly enough, this is just such a weird coincidence, but literally just last week, we were talking about that household.
I know.
That they're a bunch of criminals, basically. There he is.
Wow.
And yes, that his brother there was another incident with the brother being, arrested and a car searched for an alleged sexual assault. Wow. So, boy, I tell you, some stuff going on in that. Yeah, some stuff definitely going on in that household. So in other news, that's kind of like shocking. A Guyana politician has been arrested for the alleged rape of a 16-year-old child. So Minister of Local Government and Regional Development, Nigel Dharamlal, I think is how he might pronounce that, was arrested on Monday in relation to rape allegations levied against him by a 16-year-old Indigenous girl, and he's been released on $1 million station bail. So the Guyana police force confirmed that an investigation has been launched into the allegations against the minister. So it's not every day that you hear of a government minister, even regionally, being arrested for this sort of thing. So we'll certainly be keeping an eye on that. U.S. President Joe Biden's son has pled guilty to tax charges and possession of an unlicensed firearm. I don't know if it was unlicensed, but he wasn't supposed to have it as someone who's an addict, apparently. So he's got 2 tax misdemeanor offenses, and he struck a deal with prosecutors that they say that might keep him out of jail. That's
he won't
the
go to jail.
ultimate aim.
Yeah, he won't go to jail.
Yeah, super interesting, and hopefully he'll get some help. So cruise executives say that they're meeting the Ministry and Department of Tourism has coordinated regional meetings between the cruise industry executives, major attraction suppliers, and retailers coming up here today, actually. And the face-to-face meetings are going to take place as part of Florida Caribbean Cruise Association's Platinum Associate Membership Advisory Council. So good luck to all of them. Hopefully they can strike the balance between the big cruise ship companies, taking everything versus, the little providers getting a piece of the pie.
All right.
Those are your news headlines this beautiful Wednesday morning.
All right, Sandy, we'll catch your show coming up right now on Boba 89.1 FM, and we'll see you tomorrow for the Thursday headlines.
Fantastic.
All right, style up this summer with the late.
All right, folks, good morning. How's everyone doing? I'm just going to grab some links. We're actually going to go live on radio at 7:35. We've given ourselves a little bit of cushion in the mornings because we always seem to be getting in a little bit close to that start time. So if you're on radio, you still have a few more minutes. Let me just grab this for all of our social media folks. Good morning, everyone. Happy, what day is it? Wednesday. All right, so we're looking good. We're going to be launching here in just a few minutes. So happy Hump Day Wednesday. We got Health City in the house. We'll be learning all about headaches. This is a good topic. They can have some really amazing topics. A lot of us have suffered from headaches, and we're like, what's causing it? This is your day to tune in. 2 more minutes, and then we're going to be going live, beautiful folks. So good morning to all of my suspects. Everybody is in class. Miss Vernita Irvelin says good morning to the CMR Massive. We've got Miss Joy joining us from Texas. First Lady Diane. Miss Dean is here. Charlotte, the beautiful Charlotte. Demare is joining us from Nueva York. Says it's a good morning from New York. Omiria is also here. Miss Morna joining us from Prospect. Wee Wee is here. Miss Daisy saying buenos dias. ¿Cómo estás? All right, 2 minutes and counting. Looks like we're in for a little bit of rain today. I'm keeping an eye on the situation. Couple more seconds there, folks. Yes. I always got to synchronize my time. Make sure everything's in sync. Gorgeous. So about a minute left. Morning, Irvin. Oh, Lord. Irvin says she has headaches since she took the vaccine. Has anything else in your life changed? Sometimes it's stress, you know. You're not identifying it, but it's there. I'm so thankful I've never been a person plagued with headaches. Oh, my God. Hardly ever. 20 seconds.
Bigger, better, bolder. The cold, hard truth is taking talk to the next level. Right here on Bobo 89.1 FM, Cayman's Community Radio. We are still spilling the tea and committed to being part of the change that Cayman so desperately needs. Join Sandy Hill weekdays from 7:30 a.m. for Premier Access, Cayman Voices, Truthful Thursdays, and much more. Cayman's #1 talk show is now bigger, better, bolder, and more than talk. Getting results with hot topics, consumer reports, court exposés, and more.
I've come to set the record straight. I've come to shine the light on you. Let me introduce myself. I am the cold, hard truth.
Now, from the CMR studio in Grand Cayman, live, direct, it's the cold, hard truth. Now, join the conversation on 345-936-2626.
That number again is
345-936-2626.
All right, folks, good morning and happy Hump Day Wednesday. It is July the 21st. So hard to believe that this month has just slid by so quickly. We've basically just got about a week and a day left in the month of July. Seriously hard to believe, but we are cruising through 2023 like the beautiful year that it is. So tickled pink. Normally I'd be saying welcome to Medical Rundown Tuesdays, but today it's going to be Medical Rundown Wednesday. Health City is here to join us this beautiful Wednesday morning to talk about National Migraine and Headache Awareness Month. Wow, who knew that there was such a thing? But I think this is such an important topic because there are people who suffer from migraines, headache, what they call cluster headaches. And, you know, a lot of people worry, like the first thing you think of, did I say June or July? I meant to say June. Somebody just said, no, it's still June. June, the beautiful month of June. We're sliding right through into July. So yes, let me just say, first of all, that, headaches is something that we always think the worst when we get a headache. I've been in that situation. I was just saying before we started live that I hardly get headaches, but I've had a period of time where I had a headache for literally 8 weeks. And of course, you're thinking, oh my God, I got a brain tumor. What's wrong with me? You always think the worst. And that's why it's really, really important to have experts on, like Dr. Rose, who's going to talk to us this morning about, persistent headaches, migraines, cluster headaches, and all of this, this entire category as part of the National Migraine and Headache Awareness Month. But first of all, we have Health City's Chief Business Officer, no stranger to the program, Mr. Shamari Scott. Good morning, Shamari.
Good morning, Sandy. And I noticed you said that the month of July is passing us by.
I know, right?
So you
I'm
fast
ahead of the
forward
game.
into the next month. But yeah,
definitely ahead of the game. Looking forward to that birthday month of August. I think that's what it is.
There we go.
We're going to be celebrating. All right.
So you and Mickey born in the same month then?
Yes, wonderful people are born in the month of August. She should have known that.
That's very right. That's very right. No, but it's really exciting that we have Dr. Rose Gianmarco here with us today. Just to give a little bit of a background as to who she is. She got her medical degree at McMaster University and specialized in neurology at the University of Toronto. She's currently a neurologist at St. Joseph's Healthcare. She's the founding director, of Hamilton Headache Clinic. She's one of the directors of the Canadian Headache Society, and she's been involved in a number of headache publications over the span of her career. So just to state that, as you know, with Health City, we're always looking, if we are going to partner with the A team. And Dr. Rose actually came to us when we were looking to set up an office in Canada and to have a board of directors that were well-respected Canadian physicians that when they would come and see the facility and go back, that when we had patients, if they had questions about Health City, there's a group of board of directors that are Canadian-born physicians across various specialities that would be able to state, yes, I can vouch for it. It's world-class. I went there. The doctors are amazing. And she was one of the first that we had on that board of directors as well. And now, obviously, specializing in headaches, that's an area that we didn't have, that we were looking to fill, just understanding from our patient population that it's an issue. So we were able to partner to get her to come down every month or 2 months in order to have clinics and in order to help to fill that gap within the Cayman Islands as well.
All right, beautiful. So let's go ahead and bring Dr. Rose Gianmarco onto the program. Good morning, Dr. Rose.
Good morning, everyone. Thank you for your invitation. It's a pleasure to be here.
So wonderful to have you on the program as the headache specialist. Shamari was just giving us a little bit of background about how the relationship started with Health City. I think that headaches are, I kind of made a by the way comment before we went live, but I was saying that, I'm not a person that really gets a whole lot of headaches, but I know that when you do, it's something that's incredibly worrisome because you think there's got to be something wrong with me. There's got to be a cause why I'm having these headaches. Is that the general way to look at headaches? Like they're an indication that something is a bit off?
So just to reassure everyone, 90% of the headaches that we see in practice are benign, meaning there's nothing sinister and they're possibly tension, possibly migraine. Most of the time, it's not something sinister to worry about. However, there are some things that we will probably discuss later that are some features that might suggest, well, maybe you should get these investigated. Having said that, headaches represent probably 40% of the reason people go to emergency. And when they go to emergency, of those headache presentations, 40% of those are migraine. And we always worry when we see migraine for the first time. If someone comes to me, and typically I don't see the first time because it's tertiary care. So they've seen other people, their family doctors, the emergency department. But when they have their first migraine, and I can remember my first migraine, I was 16 years old. You think you're dying. You're absolutely right. But then when you start to have them recurring, it's almost reassuring because at that point you can make a diagnosis of migraine or whatever the case may be. So, headaches are very, very common. And I think that most people in their life will suffer from headaches of one type or the other. And headache could be anything from head pain to facial pain to dental pain to sinus pain to neck pain. And it's all lumped into that headache category.
Wow. So we've got some slides here. Obviously, we're going to go through these and talk about headaches. There are already some people who are saying that, yes, Evelyn says headaches are worrisome. Sometimes worrying about the headache gives you another headache because it's like you stress yourself out so much about what the cause of it is.
Yep.
And, you talk about migraines, and we're going to get into a bit of details here in a second about how migraines, present themselves and kind of, what can be migraine triggers and so on. But gosh, I just have so many questions around this area because I do think it's incredibly fascinating. I wanted to share that I had a little bit of an incident related to my pregnancy when I had my daughter. They always warn you about the epidural headache that can happen after you've
Right.
had an epidural. And so they say, the thing to do is have some caffeine, like drink a Pepsi or whatever. And you do all these things. And oddly enough, I was perfectly fine after I had a C-section. I was fine, came out of the hospital. And the second I came out of the hospital, I then started to have a headache that lasted like 8 weeks. And at first I thought it must be just stress of having a preemie and just going through, having a first child, all this it was a very stressful time. And, you think you're handling things well, but stress presents itself in different ways. I thought it was stress, and I'd take medication. Nothing was relieving it. It seemed to have been kind of in the back of my head. And to make a long story short, years of I did notice an increase in my blood pressure, so I was put on blood pressure meds. But these headaches were just really persistent. Regular pain meds wasn't really helping. But I found that kind of massage in the back of my head seemed to help. And then eventually I saw a neurologist before you were available, Dr. Rose. And you know what it was? I'm sure you can probably guess, Dr. Rose. It turns out that it was my occipital nerve. So I was having occipital nerve headaches because after the section, and this is why it's good to speak to experts like Dr. Rose, we kind of pieced together what was going on and eliminated a lot of possibilities. But it looks like after I had the C-section, because I was sleeping downstairs on a sofa, I did something that pinched that nerve. And so, didn't even think of that as a possibility. But sure enough, once in a while, it kind of flares up if I sleep wrong, or if I do something with my neck. And it's good to get answers. And that's why we have Dr. Rose here on the program this morning, so that we can talk about June, again, National Migraine and Headache Month. And it's just about raising awareness around headaches, migraine, and cluster headaches as well. So there's a stigma around headaches. Is that true? Like if somebody tells you that they've got a headache, are people more dismissive of those sorts of things?
Sadly, that still continues to be the case, even though we've tried and I've been in the headache field for 30 years, and we've come a long way in terms of educating the public and educating factory workers and businesses and labor and industry. But unfortunately, there still is the stigma associated with headache. And for that reason, it's very sad because patients will not often go to see a doctor because of that. If they're off work because of a headache, they won't tell the reason that they're off work is the headache itself. And I'm frequently writing letters to employers to justify why these people have to be off work occasionally because they have a migraine attack. So the stigma is there. And unfortunately, it even exists among some physicians still. And it's just lack of understanding that migraine, I'm going to talk about migraine at this point, but migraine is a neurological brain disease. And there are physical structural changes that actually occur during a migraine attack, and even in the long term after the migraines are over, and as acute thing that happens. There are MRI changes that go along with frequent migraine attacks. They're not very significant. They're not worrisome. It's just what we see, and we fully understand what they are for. But yeah, I mean, it is a very, very distinct neurological disorder. So even though there is stigma, because people often think, oh, it's a tension type headache, there's very discrete criteria for making a diagnosis of migraine, very different than tension type headache.
Right. Wow. So, of course, Dr. Rose is here to answer your questions. She's one of Canada's leading headache specialists. Feel free to give us a call at 936-2626 if you have a specific question. So we're going to talk about, and I mean, headaches can run the gamut, right? So we're going to learn a little bit more about what a headache is. So does it count as any pain then, or discomfort in the head or face? That's how you'd categorize, generally speaking, a headache?
Yeah, so headache is basically just a global term. It's like saying a
Mhm.
learning disability and then subcategorizing it into the type that it is. So if you think
Mhm.
about headache and we try and classify the headache, just to give you an idea, there's something called the International Headache Criteria. It's a classification scheme that was started in the 80s and has since been revised. And there's over 200 different headache types that are categorized in it.
Mhm.
So migraine is definitely one of the more common ones, but there are many, many, many others. And when we see patients, we try and go through this and see what the headache is from. So headache can be, as I said, sinus pain, ocular pain, nasal pain, neck pain, teeth pain,
Mhm.
temporomandibular joint pain. So it could come from many different sources. And we
Mhm.
refer to these as pain sensitive structures. And so you have to think of it in that term. You know, what I tell residents when we're going through the process and when we're teaching, we say, if you come out of taking your history, you should have the diagnosis 90% of the time. If you don't,
Mhm.
then the best way to sort it out is to say, is this a primary headache? And there's really
Mhm.
only 4 or 5 of primary headaches. And that just means not related to any secondary disease. Primary
Mhm.
headaches include migraine, tension. There's a different, very unique one called new daily persistent headache. Cluster headache is among that. And there are other
Mhm.
headaches similar to cluster classified in that. And then we take it to secondary headache. In secondary headache, there are literally hundreds of them. Basically means that the headache occurs as a result of some other underlying problem. So it could be anything from vitamin deficiency to iron deficiency to thyroid disease, a structural lesion, an inflammatory lesion. It could be a tumor, it could be an abscess, it could be a head injury, it could be a bleed, it could be a stroke. So many, many, many different causes for secondary headache. So that's
Mhm.
basically how we classify them when we start to see these patients.
Mhm. Mhm. Wow. And at least 96% of people during their lifetime will have at least one headache. How lucky is that 4%? We need to find out what makes them special.
I know. Right? If only we
So
knew. But you know what?
I
We've come
know.
so far. We really
Yeah,
have.
absolutely. So 40% of people across the world have tension type headaches, and about 10% have migraine headaches. Let's talk a little bit about what the difference is between a tension headache and a migraine headache.
So, according to the criteria system, which I told you, a migraine
Hmm.
headache is episodic, means it comes and goes, it comes and goes in most cases,
Hmm.
certainly at the beginning. It could last anywhere from 4 to 72 hours, and there are exceptions to that. Some last an hour, some last 3 or 4 days. But the key features about diagnosing migraine are the associated symptoms. So, very often you look for nausea or vomiting. And if you have a migraine, you know that you're sensitive to light, to noise, to smell. And
Hmm.
those are the features that we use to diagnose migraine. Tension type headache is a more, actually, the location of the migraine could be anywhere, but usually it's referred to as a one sided headache. But that's suggested criteria, and there's certainly variations on that in terms of the
Hmm.
location. You know, it could be dental pain, it could be jaw pain, it could be ocular pain,
Hmm.
it could be in the back of the head, it could be in the temple or in the front. So that's migraine. And then there are many subtypes of migraine, whether you have an aura or not. That's also a separate entity. Now, in terms of tension type headache, much more common, as you said. It's more diffuse. So people don't describe a throbbing pain. They describe more of a
Hmm.
band like, pressure like pain, like a scarf being tied across their head. Very often, they don't typically have nausea or vomiting. These people are not sensitive to light or noise, and that's an important distinction between migraine. And most of
Hmm.
them are able to function with their headache, except migraine patients who are typically put down for some of their migraine headaches where they really are disabled by them.
Wow. So in the morning, I do notice that sometimes I get a little bit of a headache, which I think is more of a sinus because I do have just congestion. Are sinus headaches pretty common as well?
They are, but the interesting thing about sinus headaches is when they've done very large surveys in medical offices,
Hmm.
sinus headache is probably the most common misdiagnosis for migraine. So, in other words, many, many people who have migraine headaches actually
Hmm.
have been diagnosed as sinus. And when I
Hmm.
see patients in the office, I ask them if they've had a history of migraines, and they say, no, I've just had sinus headache. But when I pursue that, their features are migraine. So it's a common misdiagnosis. And the reason for that is because of the location of the headache. Migraines can
Right.
occur the same location as sinus headache, But the other thing is that with sinus headaches, you get congestion, you might get tearing of the eyes or a sense of fullness. You can get those the exact same symptoms with a migraine headache. And sometimes it's very, very difficult to diagnose. So in order to diagnose sinus properly, you need some sort of imaging, or you need blood work showing elevated white count, or you need sort of purulent or yellowish discharge to account for it. One of the distinctions between the two, one of the clues that we use for the two in terms of clinical clues, sometimes I always ask the patient, is your headache worse when you lie down or worse when you stand up? And if you think about it, lying down in a sinus headache, all that congestion pools and gravity seems to make it pool in the back of the sinuses. The headaches typically get worse. In a migraine headache, you feel much better lying down. So just a small point. And no evidence for that in studies, but just anecdotal clinical.
Interesting. So many underlying causes, including hypertension, sinusitis, that's a tricky one. Brain tumor, which is the one that everybody always thinks, oh my God, I got a brain tumor. What percentage of headaches are caused by a brain tumor?
Probably 1 to 2%.
Very, very few.
Very few. Yeah.
Dehydration. And interestingly enough, Ramsey says drink more water. It helps to alleviate headaches. So dehydration can be a reason why you've got a headache.
Absolutely. Yeah. I mean, there are many things you don't think about, like screen time, excessive screen time, and not drinking during the day. With the days when we were wearing masks all the time and we just weren't drinking because we had a mask on all the time. Absolutely. I saw patients who had an escalation of their headaches because of that as well. So, I mean, and that brings the point to migraine management. It's very important to maintain a rigid, scheduled routine, whether it's hydration, sleep patterns, eating, not skipping meals, exercise. So regularity in all of these things helps to maximize migraine management.
Okay, wow. Very good. So we got some questions coming in the comment section. Lizette says, my 9-year-old is having headaches very often. Tell us a little bit about headaches in children, because I suspect that as a parent, this could be something that could cause a bit of concern. Do children tend to get headaches? Is that normal for them as well?
Well, headaches are not normal, but headaches can occur in children. And little boys, interestingly, are more affected with migraine than little girls. And then when they reach puberty, the females take over because of the hormonal influence. So migraines can occur in the young, and actually migraines can occur in infants if you look for the symptoms. They obviously manifest a little bit differently. In kids, if an infant is holding their head, rocking, holding their ears, vomiting, or if their tummy is distended or they seem to complain of abdominal cramping, sometimes you can get migraines that are manifested in kids as abdominal pain, and they can have excessive vomiting without actually having a headache, which makes it challenging. Kinds of things we look for in kids are motion sickness, car sickness. Those things are all sort of coexistent with a history of migraine. In terms of other causes of headache in children, obviously you rule out head injury. And the other thing is, it's worrisome headaches occurring in children just because you want to make sure that there isn't a space occupying lesion. So I would say that the index of suspicion is much higher in children, and we tend to image them obviously much quicker than we do in adults.
Wow. So you little Bret says, have his intestinal tract checked. Is there any correlation between gut health and headaches?
Yeah, and I mean, you really want to do a thorough check. You want to do a metabolic workup. You want to check things like their iron, their red count, their liver enzymes, and GI as well. But as I said, the migraines can really mimic GI disturbance. But we like to rule that out before we diagnose migraine. So good point.
Very good. Evelyn has a question. She says, why do I get headaches only when I'm sleeping, but after waking up and walking around for a little bit, it's gone?
So there are a couple of things that come to mind when you have morning headaches. One of them is sleep apnea. If you snore, if you have sleep apnea, you can wake up with morning headaches that get better as you get up and walk around. The other thing is if you have any temporomandibular joint issues and you're clenching or grinding during the night, that can frequently cause morning headaches when you wake up, and they tend to get better when you're up and moving around. And then the other thing is, you mentioned occipital neuralgia. If you're having issues with sleep and you're having neck pain and your pillow's off, or there's something wrong with your sleep in terms of positioning, you can get morning headaches from that.
Yeah, I mean, I was shocked when the neurologist finally said, well, there's something called the occipital nerve in the back of the head. And you know what was interesting? And again, this is why it's important to speak to people like Dr. Rose, who have, she's a neurologist and she's got an entire lifetime worth of professional experience. Because one of the things when I was talking to him about what helped, right? And I was saying, medication doesn't really seem to help, but if I massage the area, and he said, that's interesting. So he said, massage helps. And I said, yeah, oddly enough. And massaging that nerve, was really what made him think, I think this is exactly what he was suspicious of. And there's different types of, treatments, which we'll talk about here in a minute, what you can do for headaches. But he actually said to me, if it becomes extremely chronic and debilitating, we can actually give you an injection right in the nerve. And for some reason that made my headache go away right away. Oh, an injection where? In the back of my head? Oh my God, that didn't sound like fun.
Yeah. But it's absolutely true. You've made a couple of very good points. One is massaging it sometimes helps. The questions I ask when I'm thinking of occipital neuralgia, which is really quite common and sometimes coexists with migraine, so it really muddies the water. But the questions I ask are, does it hurt to turn your head from side to side? Does it trigger the headache? Like when you're driving, for example, if you're lying on the couch and you put pressure on the back, is it uncomfortable for you? Do you feel a sense of discomfort there? And typically it's pain at the back and it radiates to the front because that's the distribution of the occipital nerve. And you're absolutely right. Medications don't help. You need a targeted approach, and the injection doesn't go right into the nerve. It infiltrates the area around the nerve, and it basically numbs it. It's almost like a diagnostic test too, because if it goes away with the nerve block, we know that that's exactly what it was. And I have patients who have nerve blocks every 2 weeks because it's so refractory, but that's how they function.
Right. My apologies. That's my reminder, my alarm. And I mean, we'll talk about some things that help here in a second, but for me, I find that one of the things that helps is actually I use my daughter, she has a little sheet pillow from when she was a baby. I actually use that to put it right in the kind of like back of the head, where most pillows don't really fit that well. And giving that little additional extra support at night seems to make a world of difference. So let's talk in more detail about migraine headaches specifically. So what exactly is a migraine?
So as I said, it's a brain disease. So there are structural changes, functional changes that happen in the brain. They occur in about 10% of the population, more commonly in women rather than men. And it impacts everything: social, medical, or social, mental, and emotional aspects of your life. There's a genetic predisposition, probably in about anywhere from 30 to 60%. And by that, I mean, if you ask the question about family history, up to 30 to 60% of patients will say, yes, my mother and my sister have migraine. So if you think about a very simple analogy, the genetics loads the gun. This is from one of my mentors from many years ago, as he explained it. The genetics will load the gun, but then there's some stimulus, whether it's internal, meaning stress or hormones, or external, meaning maybe barometric pressure, maybe food, maybe alcohol, that triggers the gun to go off in terms of setting off the migraine. But migraine itself is caused by some neuronal dysfunction. There's probably multiple factors involved in migraine, and we know that there's a wave of depression, meaning electrical depression in the brain, that occurs as a migraine begins. And then there's a release of what we call neuropeptides. So basically chemicals that are intrinsic to the body but are released at the time of a migraine. And one of these is CGRP, which is significant because that's where one of the treatments is really targeting right now. But what the CGRP does is it causes the dilation of the vessels, and it basically causes the inflammatory change that we see. So the vessel becomes inflamed, it becomes swollen, and it starts to pulsate and becomes engorged. And so that's what actually causes the pain, is the inflammation and the swelling of the vessels. So there are chemical influences, there are electrical influences, there are what we call vascular, so the vessels will dilate. So it's a combination of this whole interplay that causes the migraine to occur.
Wow. Migraines sound very complex, Dr. Rose.
They can be. They can be, but it's interesting. When I started in this field, I'll just tell you a little scenario. I started in this field 30 years ago studying headache, and there was one theory that was suggested, and that was called the vascular theory. So they postulated that it was the constriction of the vessels that caused the aura, which is the visual changes before the headache, and then the vessels dilate, and that causes the migraine. So it's come a long way, and so have the treatments come a long way, because they're now targeting specific things in the migraine attack, which is amazing.
Very good. So 10 to 20 subclassifications for migraines. They can come with or without this aura that you're talking about. So for those of us who've never had a migraine, can you explain what the aura is?
So there are phases of migraine. The first thing of a migraine is called a prodrome. And the prodrome, only about 60 or 70% of people recognize the prodrome. But for those of you who have migraine, it's not uncommon for their partner to say, you look like you're getting a headache. The eyes become sort of flat. You get dark circles around the eyes. You may get mood changes like irritability or lethargy or extreme fatigue. And that all precedes the migraine aura. If you get a migraine aura, which is in about 30 or 40% of people, the migraine aura can be of many different types. The most common is visual. Patients will describe a kaleidoscope in their field of vision. They may see a wavy line or a lightning bolt. They may describe heat coming off a hot pavement, or they may actually have a blind spot. Very often, and in most cases, there's a sense of movement to the aura, meaning it may start in the middle and it may move out to the periphery, or there's a shimmering effect, or there's literally like lightning bolts. So it can take many different forms. If you look at migraine aura, sometimes you'll see these lacy doily patterns in the periphery. The aura precedes the migraine in most cases. It may last anywhere from 20 minutes to 3 hours, and then the migraine follows. And the migraine has the characteristics that I told you. Migraine aura is something that can occur during the migraine attack, but it can actually occur without even getting a headache. So you can get migraine without, you can get aura without the actual pain associated with it. And that's when it's a little complicated, because we're, as neurologists, do we say, are we looking at a stroke? Are we looking at a TIA? Or is this a migraine event? And the history will help you with that.
Wow. And lasting anywhere from several hours to even days. How do people function if they have a migraine for days?
It's truly amazing. There's patients, it's surprising how many patients actually continue to function with their headache. Some don't, of course. But part of the reason that migraines can go on for days at a time is because they weren't adequately treated in the beginning. And every time we give someone a prescription for medication, we always say, treat early, treat early, treat early. We have evidence that if you don't treat within the first hour, some of these medications like the triptans, Imitrex, and so on are 50% less effective. And there have actually been studies done with treating early and not treating early, and it reduces the duration of the migraine. It reduces the associated symptoms that I talked about. So there's many, many advantages to taking your medication right away as soon as you feel the headache coming.
It's really amazing. So we've got some listeners this morning who, have suffered from migraines. So they're going to give us some of their feedback. So we have, let's just see, First Lady says, right now my head hurts and I'm seeing some colors in my eyes. So First Lady, I wonder, is this an unusual occurrence for you, or do you get this often? And if so, how often? I guess those are types of questions that Dr. Rose would definitely be asking. Good morning to Carmelie. Carmelie says that she suffers from migraines every month, sometimes every week. Thanks for this topic. Irvelyn says, if I consume foods that have MSG, I get terrible headaches. So a lot of foods still have MSG. I thought we were understanding the negative health side of MSG.
You know what? I always tell patients, read the label, read the label, read the label. And there are some things that you would never guess had MSG. If you use seasoned salt, chances are pretty good. If you use barbecue sauce, If you use things like ketchup, anything, I always tell my patients anything bottled or canned, read the label, because there may be some MSG in it. And it's not just the MSG. There are so many foods, as long as we're on the topic of triggers, that trigger migraine. You know, when I give my patients a 2-page list of triggers, the reaction is, well, I eat healthy. Has nothing to do with eating healthy, because healthy foods like avocados and grapes and tomatoes and onions and garlic and green beans can trigger migraine, and they're all healthy foods. So the way to sort that out is not to cut everything out, but to keep a careful diary. And so whenever you get a headache, you write down everything you ate or drank for 12 hours before that headache started, and then cross-reference it with a migraine trigger list, which you can access on the American Headache Society website or Migraine Canada. There's a long list of triggers there. And then sort of cross-reference the two and start to highlight the things that seem to be a recurring pattern. And that's how you can help sort it out. Not by cutting everything out, but if you're noticing every time you have cheese, then try cutting it out, but then reintroduce it and challenge yourself and see if that triggers a headache.
Very, very interesting. Wow. I had no idea about MSG. Okay. Charm says that what you were describing a few minutes ago, she says, that's me. Good morning to Everton. So good to see you. Evelyn says, oh my gosh, now I know to stop using all those sauces. So what's the way to sort of, for triggers, you know, you're talking about the elimination of them and maybe slowly reintroducing them in smaller quantities. Is that kind of the best general approach then?
Well, that's what I've always used. I mean, if you have someone who has 1 or 2 migraines a month, that's relatively easy to do. Where it gets a little challenging is if I have my chronic migraine patients who have 15 to 20 headache days a month, then it's a real task, as you can imagine, keeping a food diary. And then only 40% of people can identify the triggers. So it's not everyone that's going to be able to identify them, but I would suggest start with the more common ones like alcohol, caffeine, chocolate, nuts, cheese, grapes, MSG, or any preservatives. Like, it's not just MSG. Like, you think about going to Mr. Sub. Well, what am I going to have at Mr. Sub that'll trigger a migraine? Well, just think about what they're giving you. They're giving you processed meat, cold cuts, cheese that may be processed. They're putting a sauce on there, which probably is a bottled sauce. And can trigger a migraine. But you can take it even a step further and think about things like red wine vinegar and balsamic vinegar. It's not wine, you know, it's not red wine, but it is a form of wine, and that could easily be a trigger as well. Wow. So it's a process.
Yeah.
And it took me 5 years to figure out that popcorn was a trigger for me.
Really? Popcorn? Oh my gosh.
Popcorn.
So Tina says a major trigger for me is weather changes, especially drop in the barometric pressure and dehydration. So tell us a little bit about weather. How does weather trigger?
I can't tell you too much. I can only, we don't have any evidence for it. In other words, there's only been two studies that I know of, and not really studies, but observations that have commented on barometric pressure and association. It's the change in barometric pressure and association with migraine attacks. Having said that, you know, many people in my office, the first thing they identify as a trigger is weather. So there's definitely something. Can I tell you what's behind it physiologically? No, I don't know. And nobody really understands it fully.
So Tina says nitrates in cold cuts. It could be a contributing factor as well.
Yeah.
Kizzy, good morning. Kizzy says, I have terrible migraines, lights, smell, and all hurts me terribly when I do. Wow. Even the olfactory, glands are impacted as well. Pretty crazy. All right. So let's talk about what we can look towards as some potential home remedies. So what are some of the things that help? I know in the Caribbean, we have Vicks, and Vicks apparently solves everything. You got a bad kidney, slap some Vicks on, and it solves everything. So I don't see it on this list, but I do see Tiger Balm, which is probably in the same family.
Peppermint oil. Yeah. This is actually, you can take this list and actually use it for treatment of migraine in pregnancy as well, right? Because we're limited in what we can give the pregnant migraine patient. So we generally rely on these quite heavily. But yes, things like peppermint oil, tiger balm, I always recommend that. Make sure you're hydrated. If you're not sure, just drink some water. And interestingly, that it's a paradox because we say don't drink too much caffeine, but yet when you're getting a migraine, have a cup of coffee or have a can of Coke, and it may sometimes abort it. That's only going to work if you have 1 or 2 coffees max per day. If you're drinking 4, 5, 6 coffees a day, that little trick's not going to work for you. Taking Tylenol and treating early is something that you can do. Sometimes going outside, getting a breath of fresh air, getting away from your computer. If you notice that you're starting to get a headache, check things like blue light lenses and see if that helps you. Or try and reposition yourself and check the ergonomics of where you're sitting every day. Especially during the pandemic, I saw a lot of that with people sitting at home on their couch working from their computer, and the positioning was terrible. So they started getting more and more headaches. And then sleep usually helps many attacks if you get them early. So those are home remedies.
Yes. Okay. All right, folks, we've got a caller to the program. Good morning, caller. Welcome to the program.
Hi, good morning, Miss Sandy.
Good morning.
I am so happy you guys are talking about this migraine. I have had migraines since I was maybe 9.
Oh my gosh.
And I'm in my 40s now. So, and I'm hearing your doctor talk about having more than 20 migraine days for the month. I don't think I have not had a migraine day. I have I have days when it's mild.
Yes.
And then I have days when it's tolerable. And then I have days when it's absolutely debilitating. And the thing, I'm not sure if I missed it, but another thing that triggers the migraines, I find it's the same thing that would trigger someone with a seizure, those flashing lights. So I've seen persons with their phones that ring and then it has a bright light at the back of it. That would trigger a migraine for me. Driving at nights when people have their lights on bright.
Yeah.
Wow. So how are you living with it, caller? I'm curious to know how you manage. Uh-oh. Not sure if the connection, I think, might have dropped out a second. Hi, caller. Okay, I think she dropped out. That was a WhatsApp call, so the connection was a bit sketchy. But I was kind of wondering when you see patients, Dr. Rose, that have migraines that often, it seems like they've just accepted that it's a part of their life. But my goodness, that doesn't sound like a lot of fun. How do they manage?
So it amazes me how many patients have had migraines for 30, 40 years and have never seen a specialist or had treatment for it other than over-the-counter medication. And that brings up a point of, this really has to be discussed when we talk about migraine, is medication overuse headache. Because if a patient is not getting appropriate medical treatment, they tend to treat their headaches with over-the-counter medications. And excessive use of those can trigger chronic daily headaches. So just as an example, if you're taking acetaminophen more than 3 days a week, consistently every week over a 3-month period of time, you can develop medication overuse headache. That happens with almost every over-the-counter analgesic. It can also happen with the triptans that are prescription migraine medications, and it presents as a chronic daily background headache. They can function during that headache. It's there when they wake up. They take their analgesic, it goes away, it comes back. But in addition to that, their migraines will occur at other intervals as well. So it's a very chronic condition. It's preventable by telling patients and educating them on not to overuse their medication more than 3 days a week maximum. But then once it occurs, we treat it by basically taking them off the overused medication, putting them on a preventative medication, and trying to get them back in sync.
Right. So caller, thanks for calling back. It seems like the connection dropped, but I was wondering how are you managing with having such frequent migraines?
The thing is though, Miss Sandy,
yes,
I don't take medications anymore. When it's debilitating, that's when I'll try something.
Yes.
Because I found that when I started having children, I was afraid to take medication because, of course, damage to the baby and I was breastfeeding and so on. So I learned to function. I heard you mention about functioning with the migraines. I learned to function with it. So I learned that if I don't drive at nights because of the bright lights. I don't go out in the sun too much. I make sure if I'm getting a prescription lens, I make sure it's a transition lenses, because switching from your glasses to shades and stuff will be a little difficult. So I make sure I have transition lenses to help with the glare of the sun and so on. So there are things that we do, migraine sufferers do, that help to compensate so you can function. But I tell you, when I'm home alone with my kids, is when I'm scared, because if I get a migraine that's really, really bad to the point where it leaves me with nausea and vomiting and so on, I get scared. I get scared because then I can't see. You spoke about the aura.
Yes.
You're blinded. You're totally blinded.
Wow. And do
That's
your
how my
kids,
aura is.
how old are your kids now?
My kids are 17 and 8.
Okay. So they have an idea that you obviously are suffering.
They have an idea. I try not to get those migraines, so I try to stay away from the triggers because it traumatizes them whenever they see me like that. I mean, I'm totally down and out.
Right.
I can't move. I'm weak. I'm vomiting. And you see, the thing is, it's pain. So persons don't understand that it is something that will leave you crippled.
Have you ever gone to see a Dr. Rose in your life, a specialist, a neurologist?
I have seen a neurologist.
Yes.
I was diagnosed some years ago with a brain tumor, but that was resolved through medication. So I don't have that anymore. But I was diagnosed a few years ago.
And that neurologist was also a headache specialist, or?
I don't know that they were a headache specialist.
Okay.
But it was a neurologist.
Okay. All right. Well, Carla, thank you so much for sharing your story with us.
So there are so many people like that I see. And just to make a point, in the last 3 years, there has been such an influx of new targeted migraine medication that if I would encourage people that if you are living with the migraines, and even if you've seen someone 10 years ago, there are so many other things that you can be offered for acute treatment, but also for prevention. So I would encourage you to maybe see someone again and see if there's something new that you can get.
Right. Thank you so much for that, Dr. Rose. And of course, Dr. Rose, not every neurologist is a headache specialist necessarily. So sometimes seeing a headache specialist might be the route to go.
Could be.
Yeah.
There are treatments like, for example, the new injectable treatment.
I think now is a good time just to remind people that Dr. Rose will be here on July 21st and 22nd.
Okay.
So obviously, if anybody's suffering from migraines or headache, and you just would like to have a consult either to learn what's newer in regards to the science, you can always call us at 640-4040 or email us at info@healthcity.ky to make sure that you can get in to have a consult with Dr. Rose, who will be here July 21st and 22nd.
Wonderful. So some comments continuing to come in, but before we get to some of those, the question is, when do you see a doctor? And we do have a caller in the line as well. So if you have 2 or more headaches a week, you take a pain reliever for your headaches most days. You need more than the recommended dose of over-the-counter pain remedies to relieve your headaches. Your headache pattern changes or your headache worsens, and if your headache is disabling, those are some times that you then want to consider actually seeing Dr. Rose. So good morning, caller, and welcome to the program.
Morning.
Morning.
I have 2 questions. One is, could a nutrient deficiency cause a headache? And the second question is, what is the strangest cause of a headache you have ever encountered?
Can you repeat that, because you cut out, or maybe you could repeat it for him? I cut out and I didn't hear the questions. I heard the second question was the strangest cause of a headache.
Yeah.
And what was the other?
And the first question is, can a nutrient deficiency cause a headache? And if so, what?
Can a nutritional deficiency cause a headache?
A nutrient deficiency.
Yeah. So there are certain vitamin deficiencies sometimes that can contribute to headache, and also things like iron deficiency can contribute to headache, not migraine, but headache, B12 deficiency, magnesium deficiency. So and thyroid issues, which is a deficiency as well. So anything metabolic that we refer to could potentially contribute to headache, not necessarily migraine. If you have migraine, then it could make your migraine worse. And in terms of the strangest cause of headache, there are some things like medication that we never suspected. There are things like COVID, which raises a real issue. But COVID vaccines were coming a lot when we're having vaccinations. And there's a post-COVID headache that actually could be so prolonged that it goes on for a couple of years.
Did you just say years, Dr. Rose?
2 years.
Did you say years? Oh my gosh. Yeah. Is that part of long haul COVID then?
Not necessarily. You can get just the headache, but it certainly could be part of the whole long haul. Yeah.
Wow. Thank you so much, caller. Can I just tell you, it's so interesting that you mentioned COVID, because I forgot that when I finally got COVID, because everybody had like the first wave of COVID, everybody got it. Even in my household, my husband and daughter had it. I didn't get it till literally just last, I think it was like October or November. But you know how I knew it was different as I was listening to you? It was the headache. I had this headache, didn't have any other symptoms, but I had this headache that forced me to lie down. And it was a headache that, again, I took meds for, and nothing was moving the headache. Like, I did the show in the morning. It was kind of there, and like hours later it was still there, and I'm like, what is this? And I remember using my I have a TENS machine. When things get really bad, I have to resort to that for pain management. But I remember thinking, I'm going to use my TENS machine on like my neck, my head, whatever, and nothing was helping. And finally my house manager, Miss Stacy, said, I bet you have COVID, because I think she had some kind of weird headache when she caught COVID. And I thought, a headache and COVID? I'm like, that doesn't sound right. I don't have the sniffles. I don't have anything else. And sure enough, I tested and I was positive for COVID.
Did you get your
thankfully,
sinuses?
It's not lasting for 2 years, I don't think.
Yeah.
So,
did you get your sinuses x-rayed during that?
No.
Okay. One of the common causes for headache during COVID, if you have COVID, is sinus involvement. You can get sinusitis, you can get sinus congestion. My daughter actually had that, and it went on for months. She had COVID 3 times. And she had excruciating headaches as a result of that. But the headaches that occur post-COVID that I was talking about can take any shape or form. If you have a history of migraine, typically the migraines will get much worse. But more commonly, it's a whole different type of headache. It's just an ongoing, daily, moderate to severe headache that just doesn't let up. And then after, in the articles that have been published, because obviously it's very new and we're just learning as we go along, they seem to go on for about a year or two and then just kind of burn themselves out.
So Anna says, good morning to everyone. I personally do suffer from migraine headaches. And the sad thing about it is I can't take any painkillers to ease it. For some reason, I find it unhelpful. But the good news is I do believe in natural medicines. And I've been taking a garlic every morning. And I find it helpful. Putting ice helps. And but my natural remedy really helps me. So garlic, okay. Interesting.
Yeah, no studies to suggest that, but I'll just add something to the natural remedies if that's your preference. I start all my patients on 3 vitamins, magnesium citrate, 300 milligrams twice a day. B2 or riboflavin is the other name for it, 200 milligrams twice a day. Vitamin D. And also, if that doesn't work, then we start to go to things like coenzyme Q10. So these are all natural remedies if you want something to add to preventative treatment and you don't necessarily want medication.
Beautiful. All right. Jennifer says they said that food is created when you're cooking them. Food. They said that food create when you're cooking them MSG. MSG is from sugarcane because Chinese substitute sugarcane with MSG. I don't know a whole lot about the compilation of MSG. Good morning to Miss Ethel. Miss Corrine says, I have migraines so often and they last for days. I hate them. Again, Corrine, Dr. Rose is going to be here next month. Perhaps go and see her. Jerry says, flashes of light and hunger triggers mine. And the only remedy for me is to sleep in a dark place or puke. Oh, my Lord. So on the slides, on the screen, some ways in which, speaking to Jerry about just sleeping it oftentimes, how to manage headaches. Number one, know your triggers so that you can avoid them. Eat on time. Eat a balanced diet, so avoid foods with nitrates. Drink a lot of water to stay hydrated. Reduce alcohol consumption. And I was just, someone was saying to me just a couple days ago that drinking wine brings on a headache for her. So, Get enough sleep. That's one that a lot of us struggle with. Exercise regularly. Reduce caffeine intake. They put eat on time twice. I'm not sure if that was intentional, but stressful. Stressing you. Eat on time. And speak with a professional to manage your stress, because a lot of times we're stressed out and we don't even know that we are. So Evelyn says that she was an avid coffee drinker. She stopped drinking coffee for years and just recently started back just last week, and it helps. Good morning to Alejandro. Tina says, yes, strobe lights are definitely a trigger. Lenny says, my triggers are strobe lights, and I suffer from acute vascular migraines with the aura and take Maxil. What is this? Maxil?
Maxil.
MLT dissolved tabs. Yeah. Take some symptoms away in 5 minutes. Wow. Okay, Lenny. Evelyn says that she can't do cheese, alcohol, chocolate, wine, nuts. Almost everything triggers a migraine for me. Good grief. Whoa. And she's taking Excedrin migraine. Kizzy, lots of sharing this morning, says I'm guilty of the overuse of OTC meds. Nothing seems to work for me. My migraine lasts for about a week, getting only 2.5 hours of sleep. Even in my sleep, it hurts. So sounds like Kizzy's a good candidate, Dr. Rose, to probably come and see you. Yeah, Kizzy. What's the dates again in July that she's here, Shamari?
So Dr. Rose will be here on the 20th and the 21st, which is a Thursday and Friday. So go ahead and email us at info@healthcity.ky so that we can go ahead and schedule in to see Dr. Rose.
Chanel says, I was once told the headaches I'm having is called ice pick headaches. What is that?
Ice pick headaches can be a form of migraine. They're also called thunderclap headaches. They're also called jabs and jolt. And it's literally like someone's putting an ice pick through your brain. They are very short-lived. They are stabbing. It's the kind of headache where you simply stop and hold your head, but then it's gone. And if it happens once or twice a week, it's manageable. But if I have patients who have these 5, 6, 10 times a day, and it's thought to be a form of migraine. And what we do for those patients is we put them on a preventative, not forever, just for a short period of time to break the cycle. The good news is that they generally burn themselves out. So people tend to get better on their own from these. And in cases where they don't, there is a preventative medication that sometimes helps.
Yeah. So being very, very careful with OTCs, that's over-the-counter medication. We do have a caller in the line. Good morning, caller. Welcome to the program.
Yeah, hi. Morning, Sandra.
Morning.
Can you ask what type of preventative treatments or behaviors, maybe I've missed it, but what type of treatments or behaviors should one employ in their lifestyles to help this type of a health risk? And also, I think I heard someone just moments ago mention lifestyle behaviors. If maybe we could hear a little bit about that as well.
Yes. So we did talk about managing headaches and also, when you should see a physician, and of course, Some home remedies discuss everything from peppermint oil, tiger balm, staying hydrated, having some caffeine, taking a nap in a quiet room, and a break from screen time. So yes, I think that was covered, but thank you for the question.
Okay, thank you, Sandra.
All right, you're most welcome. So thank you so much. Everton says, do you know if you wear the correct prescription? If you wear glasses, that can trigger headache too. So of course, eye strain, if you're not, you're not having your prescription checked. And sometimes, I remember this in high school, you didn't realize that you needed glasses. You didn't realize how much you were squinting and that you were getting these headaches because you were having to squint and strain your eyes. And then all of a sudden, you could see clearly when you put those specs on. So doing things like, if you go to Dr. Rose, I'm sure she's going to ask you these types of questions. When was the last time you had a vision check and things such as that? Everton says, for me, my headache comes when I have to strain my eyes to see. So, because I don't wear glasses, which I should. So definitely, Everton, make that a priority. So Alice, good morning to you. So of course, Dr. Rose Gianmarco is going to be here July the 20th and the 21st. She provides holistic health services, treating common health conditions such as headaches. She's a headache specialist and a neurologist, and you can come to the clinic that she'll be having at Health City. She'll be here two days next month, one of Canada's leading headache specialists. So Dr. Rose, thank you so much for coming on the program today. I think just the fact that you have answered so many amazing questions and there's been so much engagement, obviously this is something that impacts a lot of people. And I encourage people, just with anything else, there's nothing wrong with sitting down and just having a chat with a specialist like Dr. Rose to see what might be the next step. She's talked about recent advances in the area of, headache, medication that could very well help you. So at least go and see her and speak with her.
Thank you.
Dr. Rose,
and thanks for the invitation.
Absolutely.
Okay.
All right, Shamari, very good show as usual. Thank you so much.
And this is, a huge thank you to Dr. Rose, one for the partnership and everything she's done for us in Canada when it comes to patients who are coming for all various ailments directly to Health City. But outside of that, now for the partnership, filling a gap in the Cayman Islands in regards to headaches that as you would have seen from the statistics, there are quite a few people who get them and who need help with them. And she's bringing her expertise right here, traveling to Cayman in order to have those consultations. And I must state that I was guilty early in my career when I used to hear of persons having headaches, being somebody who I can count probably maybe 3 times ever having a headache. So I couldn't really empathize at the time until I actually had a roommate who, when he used to have a headache, he used to have to go to a room, turn off all the lights. And for somebody who was very active, you wouldn't see him for hours, if not was on the weekend for days at a time. And then I really got to understand that, wow, this is real. This happens. And I can only imagine people who have to go through that on an ongoing basis. And if you don't have an employer that actually, is empathetic, it could cause issues in the workplace as well. And I think that's why we have these education forums, not only for the headache sufferers, for the persons who don't have headaches, who may not understand, but to have an expert like Dr. Rose actually here explaining the causes, the issues, and how bad it can actually be. I think it helps for everybody to be a little bit more empathetic for persons who have serious headaches or who have migraines and may need some time off work, or obviously may need some time to go see the doctor as well. So thank you, Dr. Rose. And my WhatsApp is lighting up. So there are a lot of people who are very appreciative of this session, Sandy. So thank you as always.
Yes, absolutely. Pat says, great show.
640-4040 and info@healthcity.ky if you'd like to have an appointment with Dr. Rose.
Right. And Jim is saying that he appreciates that the doctor talked about starting people on things like the magnesium and the vitamins before looking at a prescription drug. What's the cost of a consultation to come in and see Dr. Rose?
I'm going to leave that to you.
Yeah.
Yeah.
Yeah, that one I don't know off the top of my head, just because.
Okay, so just give them a
but
call.
anybody, info at healthcity.ky will be able to give you an answer right away.
Yes, wonderful. All right, so again, thanks to our Health City guests this week. We have Dr. Rose, neurologist and migraine specialist, Dr. Rose Gianmarco, and Shamari Scott, who is the Chief Business Officer at Health City Cayman Islands. You guys have a fantastic day.
You do as well, Sandy.
Thank you.
All righty. Thanks very much. Okay, another fantastic show from Health City. I mean, they bring in some serious topics. As Shamari said, it makes you just more knowledgeable and aware, which I think is, obviously super, super important. Very, very fascinating. Let's take a commercial break. We'll be right back after these messages.
Ocean Ridge Heights offers an amazing opportunity to own a piece of land in idyllic Cayman Brac, right on the bluff, starting from $80,000. Located in a quiet residential area with high elevation, these lots are ideal for a future home or investment property and are sure to go fast. Cayman Brac offers a laid-back lifestyle, amazing pristine diving, limestone caves, diverse flora, along with amazing wildlife. Inquire about the owner financing options so that you can secure your piece of paradise today. With only a few lots remaining, these are sure to go before you know it. Contact Crichton Properties today on 345-949-5250 or info@crichtonproperties.com.
Recover Personal Injury Attorneys, helping injured people get what they deserve. Did you know that insurance companies have lawyers that represent their interests? Before signing and accepting any settlement, know your rights. Call us today for a free consultation at 924-9999. That's 924-9999. Recover. Your personal injury attorneys are on standby to assist.
In the mornings, no one wants to miss listening to The Cold Hard Truth or reading CMR. Cayman's #1 news platform has made your morning commute fun again. Pass this time with The Cold Hard Truth on weekdays from 7:30 a.m. Talk radio that's engaging, entertaining, and enlightening. But be careful. Some mornings it's so hot, you might run into a bit of trouble.
All right. Good morning, folks. Welcome back to the program. As Dean says, a good listen. Appreciate this segment today. Lizette said, thanks. Very good show. Pat agrees. She says, great show. Thanks. So yes, again, thank you guys so much for tuning in. Obviously, that is a segment that resonated with a lot of people, which I find these Health City segments certainly do. I have friends who suffer from migraines, and I know the struggles, especially the caller earlier talked about being a mom and how scary it is for like kids and babies, and you feel like you need someone around to help you if you are a migraine sufferer and it's really that bad where you are unable to help yourself, much less anyone else. So Alejandro says, who created that dog ad? Pretty funny, right? Good morning to Dawn. Dawn says, great show. Thank you so much, Miss Dawn. Okay, so we are going to be, that was our Health City Cayman Islands segment. Normally it's on a Tuesday mornings. Tune in every Tuesday morning, 7:35. I did notice that someone made the observation this morning, Gabby said, not on radio. So we've moved the radio start time to 7:35 just to give us a little bit of a cushion in the mornings between our transition when we're doing the Spilling the Tea segment with Sandy over in 106 to going live on Bobo. So I don't move, but we need them to move out of the way, so to speak. And then we actually get started with the show here. So if someone has, I'm doing a bit of a urgent plea this morning. You guys are most certainly aware of the fact that I'm an animal lover, in particular dogs. I kind of feel like cats are all right, but I'm really a dog person. I do not like to see any animals being mistreated or abused or neglected in any way. We've got a bit of a situation that is shocking this morning, but we have a black dog that is tied up by the government car park next to the passport office. So it looks like someone may have gone to, I don't know, do some business at the passport office, or you hear that thunder, or the government building, decided to take the poor dog with them, which I don't know why you would, but now they've got him tied up out there. And folks, it's raining. Y'all hear that thunder? Yes, honey child. Don't be afraid now because we got backup generator here. So we'll be good even if the power goes out. But yes, my lovelies, whoever this dog belongs to, I'm asking you to please go and collect your dog. This is no bueno. Look at the poor little thing. Look at him, my freedom. It's like he wants to go. Look, he's like going, and somebody thought it was a smart idea to actually have him tied up to what is that? That's one of the things that goes up to the power line, I think, right? Please go get your dog. I understand it's raining and the dog is getting wet. Poor little ting. He reminds me of my aunt's dog, Prince. Aunt Lottie had a dog that looked just like this with that little white patch on his chest area. He was all black and had a little white patch. And this little fella just wants to get home and stay out of the rain. So please go collect your dog. Listen, I don't know why y'all taking the dog to the government building. You trying to get him stayed? So what? Does he need a passport? Like, why would you need to take him there? Look at him, poor ting. He's like, I don't want to be here. I want to be home. Hopefully in a better place. Hopefully home is better than this. But folks, yeah, take your dogs out of the rain. It's just sometimes you're better off just leaving your dogs home in a safe space. This is not a good place for the dog. So yes, y'all heard that thunder. Somebody said they're all the way in town and they heard that thunder as well. What's the statistic about thunder and lightning? Like the closer they are together is the closer the clap of thunder and the lightning flash means the storm is like the storm is right on top of you, sort of thing. What is that correlation? Any weather people here? Jerry says, I was just wondering about that dog. He even has a doghouse. If he even has a doghouse, poor thing. I hope he does. And folks, dogs, I'm very fortunate to have dogs that don't mind rain, water, like when I have to go walk them. They don't mind it, but they shouldn't be left out in the elements. They shouldn't be left out in the rain. And some dogs get very, we haven't had a storm since Zeus has been here, but some dogs get very nervous with like lightning and thunder and storms. And somebody was talking about the drop in barometric pressure. Dogs feel these things. They like a lot of animals, they know when a storm's coming and they can feel it. And some of them get very, very nervous. I had a dog, Oscar, that, oh my God, poor thing. I even did a number in him. I actually think it shortened the lives of my two dogs. It was just very, very traumatic. So much so that after Ivan, because Oscar was always a little bit on edge anyway, right? But after Ivan, he never, if there was any rain outside or if the windows would start to like rattle a little bit, he was petrified because it was like a memory. You can't explain to a dog what a hurricane is, right? They just try to cope. And so you've got to create a safe environment for your pets, folks. And so after Ivan, what he used to do is he learned how to push up the windows, and I wouldn't always lock the front windows of my apartment. And he would literally, I had no idea he had so much strength in his neck, first of all, but he would push the window up, like, the slide up windows, push out the screen, jump out the screen, leave the other dog, Rupert, behind, because he was like, I'm not going anywhere. He would leave him behind and he would take off. And it was just because he was scared of like the noise and the thunder and all that kind of stuff. And I noticed that there was a difference of it really getting worse after Hurricane Ivan. And I'll never forget, I had a neighbor, Mr. Scotty from the BRAC. Big shout out, Mr. Scott. He would call me and he said, Sandy, that dog, that Oscar gone again. He gone again. And I was like, Lord. So I'd have to run home. After a while, I realized exactly what was going on. I said, poor Oscar. He feels safer outside, which was weird because I'm like, outside is where the lightning and thunder is, honey child. Go hide under the bed. But he just didn't like being inside in a confined area after Ivan. And so, they wrote out Ivan kind of at home alone, which is, what I thought was safest for them at the time. But So yes, he would just go out running, and then he'd come back when he felt safe and wait for you by the front door. Bless his little heart. So Jamar says that he's hearing that thunder and hearing the thunder. Yes, hearing the thunder and seeing the lightning probably in Crystal Harbor as well. So, yep, some weather rolling through. And of course, we're going to be looking at the storm here in a second. Siobhan, let me say she's calling that person jackass of the day. That's not the exact word that she used. Perla says, I love to hear thunder. Honey, chill. If I'm inside, all cuddled up, I guess I don't mind. Alejandro says, yo, that lightning wasn't normal. Just as Sandy say, talking about that dog, I feel like going to check on that dog now. Yeah, poor thing. Listen, not everybody should own a dog. Can I just tell y'all? Some of you really should not be pet owners, just like some of y'all shouldn't be parents. And somebody just needs to tell you the cold hard truth. Don't mess with it if it's not for you. Oh my gosh. Jim says that pup is stressing. You can see it, right? Alejandro says crackhead status. No, sir. Yeah, and he is a little cutie patootie. Jim says common sense out the window for some people. What a mess. Gareth says, yep, I got it. I get paid for it. He's part of the weather team over at the National Weather Service. Siobhan says, I hear the thunder. The dog house is with the dog? Wait a minute. Say what? What? The dog house? Is that right? Am I reading that right? Am I confused? Miss Morna, good morning. Says, remember Sandy, they have to go to planning for doghouse, laughing out loud. You're so silly. Not a doghouse. But you want to make sure, folks, that you have, now that we're talking about hurricanes here, we're going to check on Bret here in a second, that you make sure you have a plan for your dog, just like you have a hurricane plan for yourself. Not all shelters are pet friendly. So ensure that you know what you're going to do with your dog. Some dogs are bigger and it's not practical to take them to shelter. Where will you keep the dogs? In my instance, I was telling you guys about Oscar and Rupert, because we had a second story upstairs. That's where I allowed them to go because I wasn't sure how much flooding. I mean, none of us anticipated Ivan to be what it was, right? But I wasn't sure what the downstairs would be like. So I gave them access to the upstairs. And in a way, I was thankful that I did. We didn't really have a whole lot of flooding downstairs, but some water did come inside. But what was really, really interesting is because there was roof damage and part of the roof was lost on that apartment complex, they had the trauma of, shingles and part of the roof actually coming off. So these things can be very, very traumatic for people and children and dogs as well. So please have a plan. Garrett says lightning is faster than thunder. So you see the lightning before hearing the thunder. And if you count the seconds until the thunder, you can tell the distance and how far the lightning is from your relative location. That's what I was trying to say. All of that. Gareth is expert here. Good morning to Miss Beulah. Marshall's having some rain. And where's that? North Carolina. Speaking of rain. So on Monday, I told y'all I did a quick in and out in Miami for the day. Like I literally went up that morning. By the way, anybody from Cayman Airways listening to the show this morning, can we get some more of those? I know y'all are all over the place trying to go to LA and Panama and this place, not this place. I love it. That's fantastic. But you know what? That one day trip, the ability to go in the mornings and come out of Miami relatively quickly, like come back that night, is just amazing. Can y'all please, pretty please, add a few of those back to the schedule? It really makes a world of difference. I can't always go and overnight and all that kind of stuff, honey child. But if I can quickly get in and out, that I'm all about that life. So I went to Miami for the day. The people that I use, my car rental people, sent me reservations for a car. And I replied to them. I said, you know what? Upgrade me to an SUV. Something just told me in the back of my head, I didn't want a car this trip. To be honest, a lot of times in Miami, I don't really want to drive a car. I feel a little bit safer in an SUV, right? So anyway, boy, am I thankful for that little bit of, I don't know, intuition, call it whatever you want, because they had so much rain in Miami for the day. I know some people were pulled over. There were other Caymanians there who were like, "Oh, Sandy, oh man, the traffic is horrible." I got stuck in some of the traffic as well. And what I was most surprised at, having not ever lived in Miami, I didn't know Miami has something in common with the Cayman Islands. What do they have in common with us? Well, I'm going to show y'all. Because when I saw this, I was like, honey child, this looks like Smith Road. Look, yeah. Flooded, underwater. Look at that. That is right off of Flagler. I was like, I mean, it wasn't that much rain. The place was under, look, you'll see a car here in a second. See that car right there in the middle? Flooded out. I'm like, praise the Lord, I didn't get a car, honey child. I would have been stuck right there in that water. Can you imagine? I had no idea that Miami flood. Look, this is the parking lot. That looks like Smith Road Plaza. Not Smith Road Plaza. Pasadena Place. After a good little rain, Pasadena Place is underwater. What a mess. I tell you, look at that. Like literally underwater. Huh. Wow. I was like, that's interesting. We have a lot in common with Miami, apparently. Low-lying areas. You know, they talk about all the concerns around global warming. And one of the concerns is cities and places like Miami and a lot of the Caribbean, as the waters start to rise, we're all going to sink. So, you know, very, very interesting. But yes, they had some rain weather. And of course, you know, that causes accidents and people to slow down, which is good when they slow down on the interstate. And literally my poor little GPS was like, to get from here to there, it's going to be an hour because of traffic delays. I was like, oh Lord, barely made it to the airport in time. Like literally I was like 5 minutes left. People like, oh girl, you better hurry up. They soon close off the, they're like, they soon close off the counter. And I was like, oh my gosh, I tell the driver, you gotta hurry. I can't miss my flight. I don't want to overnight in Miami. I gotta go. I gotta get back to work. Anyway, thankfully I made it on time. And one of the reasons why I literally only went in to check my mailbox and pick up a few things. So theoretically speaking, it should have been a pretty quick in and out. But one of the things that actually had me delayed is you are not going to guess what I was doing. Did I post this one on social media as yet? Okay. So I, as you guys know, a little bit of a foodie, and I love some certain things, like particular things, right? Y'all know how it is. You just love certain things. So in the States, I have a lot of food memories, as my aunt calls them. And one of my favorite places to go is Boston Market. But it is becoming more and more difficult to find a Boston Market. What on earth is going on? Can somebody explain this to me? Because I'm upset. Look, you know, they've closed down all the one that was in Doral was my favorite because I go to Doral. I'm in that area. I can go to Dolphin Mall. I can go to International Mall. Bam, bam, bam. Super Walmart right over there. Sam's Club. Like everything is like conveniently, you know, very, very centralized. Good area of Miami, I guess, as Miami goes. In and out, not too far from the airport. Well, honey child, they closed that one. I was disappointed to find out a few months back. And then I'm like looking online to see where else is there a Boston Market. Now, you guys know I'm not a Hialeah person. I probably have not been to Hialeah in like 20 years. Like when I first moved to Cayman, I started going to Miami because I didn't grow up in Miami. I grew up in Tampa. Tampa is very different than Miami. And I was like, not really feeling Miami. But honey child, look at the Hialeah Boston Market. It has a sign on it that says space available. Oh my gosh. They have closed. I was so upset. I'm like, what? So I think, anybody who lives in Miami, let me know. I think there is one left at 22nd, and I don't know what the intersection is, but somewhere in 22nd. I believe that is the only Boston Market that remains in Miami. I'm shocked. Like I'm not going to Palm Beach and all these other places trying to find a Boston Market, but they're disappearing. And I don't know why. Their little chicken be so good and juicy. And I love the mac and cheese and their little cornbread. Please don't make Boston Market go away. Oh my gosh, I'm so upset. We've lost so many good, retailers over the years. Things just disappear. But when it comes to my restaurants, I'm like, don't be messing with no Boston Market. But I think there's one left, but I didn't have time because I went to this one, wasted time, then got stuck in traffic on the interstate. And so I was lost for what am I going to do? And I was kind of going to push it and try to run back and see if the 1 on 22nd is actually there. And I was like, no, girl, you better make your way to that airport. You better go return this car and get to the airport, or you're going to be sleeping in Miami tonight. So I had to make a smart decision and forget about my stomach for a second. But child, if I had found a Boston Market, I would have been bringing back like 4 plates of food. Mm-hmm. I saw somebody do that. He works at the airport. Does he actually work for Cayman Airways? But anyway, he flew up on the morning flight as well and came back on the same flight with me. And he had him some Taco Bell. Caymanians, Nina. He had him some Taco Bell, and what was the other restaurant that he said he went to? I don't know. Some Chipotle, I don't know, somewhere else. But definitely Taco Bell was in the bag. And he's like, oh, I got like $100-something worth of food in this bag, and it's so expensive now. I was like, wow, okay. Sometimes I've done that with Cheesecake Factory, like I grab a salad and eat it on the plane or whatever. But yes, my darling, Boston Market disappearing. I don't know what's going on. Marshall says Miami and Fort Lauderdale floods a lot when it rains. Well, we saw just the other day that that flooding the airport in Fort Lauderdale was under. I mean, that shocked me, the amount of rain that they received in such a short space of time. When you get drenched that hard, you can kind of understand it, but whoa, crazy. So Marshall's getting rain in North Carolina. Oh, Jim says they're closing down. No, not my Boston Market. Marshall says there's one close to him, about 40 minutes away. Oh my gosh. Ugh, I just can't even. So anybody who's in Miami, let me know, please, about that Boston Market on 22nd. If it's still there, the next time I go, I'll go check it out before they all disappear. Get my last fix. All right, so we've got an update for you on the arrests and charges now of one of the 2 suspects involved in the Scotiabank robbery. It's just so funny. Life can be so ironic. We sit here, folks, and we have a lot of conversations about a lot of different things. And I know sometimes you're listening, you're like, yeah, what's Sandy going on about today? And sometimes I say so much and not more, and I know more. And then sometimes it's just a coincidence that I'm talking about something and then it becomes relevant at a later date. Well, remember last week, I want to say it must have been Wednesday or Thursday. So it was before the robbery. I was talking about this residence down in Palmdale, which we have talked about before because they're one of those households that has a dog. The dog has bitten multiple people. And for whatever reason, I hope animal control and police listening this morning, the police appeared incapable of going and confiscating this dog. And he's obviously presenting himself as a dangerous dog, now having bitten multiple people. And the reason why certain individuals have dogs like this is so that they can, when the police come, they can basically buy themselves time and run through the bushes in the back of the yard because, they've got the dog who's going to be barking at the police and going on like crazy. I hate to say it, but one of these days, the police might take an approach where they're going to just shoot the dog and move on. Of course, we don't want that. But when you have criminals who are misusing and abusing certain breeds in particular as protection for themselves, this is exactly what it's going to come down to. And I think we need policies in place before it gets to that, right? The poor animals should not be suffering because they have owners who are crackheads or drug addicts or running a numbers game or whatever illegal activity that they're in. So I had brought up on several occasions previously about the situation with the dog. I also brought up about the fact that the young man there just last week had the police go and basically raid the location, allegedly arrested him for a sexual assault, took the car, processed the car, and then returned the car. Do you guys remember me telling you about this? If you're an avid listener to the show, you would have heard me talking about the situation down in Palmdale. These people live all the way in the back of Palmdale. It was Wednesday or Thursday morning for sure. And guess what? Guess what? There's a connection to that same household, folks, with the the Scotiabank incident on Friday. Let me break it down for you now, honey chill. This guy, police say, well, not police, because they never tell you who they are, but we got sources, so we finds out. Charged yesterday, Richard Scott, 27. They say of Georgetown. Now, Caymanians are very perturbed. I don't know why the police do this. It maybe shows their level of ignorance. And I don't mean that in a bad way. I'm saying they just don't know, but they need to pay attention because they live here in the community. PR people need to pay attention. When you say that he's from Georgetown or of Georgetown or whatever, listen, change the wording, please. Okay? Because Caymanians know that this man not no Georgetowner. And they don't want you calling him a Georgetowner if he not no Georgetowner. Okay? Just like if it was West Bay. Listen, he not West Bay. Okay? Caymanians are very funny about that sort of thing. And just because someone lives in a district, that does not mean that they're from that district. So don't say a Georgetown man. He not Georgetowner. This fella is a Jamaican national. His mummy is at that same residence as where all them live. They've been trying to raid that house again. 27-year-old Richard Scott has now been charged with robbery, attempted robbery, possession of an unlicensed firearm with intent to commit robbery in relation to the armed robbery incident that happened at Scotiabank in Red Bay on Friday. 2 men, they say, entered the bank, demanded money from a customer at the ATM machine before fleeing on bicycles. Now, just a note here. Remember there was another bicycle robbery that took place the weekend before at the Sandbar? And so they're wondering, is this the same bicycle bandits? That's what we're going to call them. Are these the same bicycle bandits? I kind of don't think so, because my sources say that person was in all likelihood a Caymanian based on, observations. So I don't think so, but my goodness, this concept of getting away on a bike, what that means is obviously they think, jumping on a bike is a good, easy way to make a quick getaway. Well, praise the Lord for the man that we understand ran him over. Yes, we should have run him over a little bit more. But anyway, they entered the bank, demanded money from a customer at the ATM before fleeing on bicycles. A member of the public that witnessed the offenders fleeing the bank pursued them in his vehicle to Old Crew Road, where he intercepted one of them. Both offenders then fled on foot into a bush area beside the road. They were pursued by the police into the bush, where one of them was apprehended and arrested. Police say that investigations are continuing, and detectives are appealing to anyone who might have information on the whereabouts of the second man involved in the incident to come forward. So here's the thing now, folks. This is very, very interesting. But at the time, the day of the incident, one of the rumors that was in circulation is that one of the eyewitnesses noticed one of these robbers and said, "Oh, he looks familiar. He works at a construction site in Cayman Bay." So they said that they've noticed him working at a construction site in Cayman Bay. Well, guess what? His mommy, the same one who lived down Crew Road, Jamaican lady, happens to have a little construction business. And they're wearing construction clothes. Remember what people said? They were dressed like construction workers. So this all ties in now and sure does seem to make a lot of sense. The other fella who's still at large, all they need to do is go to the construction site, honey child, because my sources tell me he works for the mummy too. And it shouldn't be that hard to figure out who he is. Say what they say. The next guy is also one of her workers. They don't have a name yet, but I don't know how many workers she got, but you start with there and you should be able to, sort that out quickly. in terms of identifying him. What a hot mess. Ay. He should be looking at 10 to 15 years in prison easy, and then deportation afterwards. Speaking of deportation, I ran into someone yesterday and they said, what's the criteria for deportation? How do we ensure that after people come out of serving a sentence that, that would be CBC, that they're on the ball when it comes to deportation? Well, hopefully they're paying attention. You commit an offense in this country, I'm sorry. A serious offense that sent you to jail, you have lost all right. I don't care nothing about no human rights. Now listen carefully. You've lost all rights to be in this country, honey child, because it's not just a right, it is a privilege. And you should be respecting our laws, right? And if you're a wannabe criminal, wannabe gangster, and you can't respect the laws, then you got to go. It's as simple as that. Serve your time, because you can't trust that the people back home is going to make them serve their time. So make them serve their time and then send them right back. Fingerprint them, DNA test, whatever you got to do, because they'll be back on the next illegal boat pretending to be somebody else. Did you guys see the news report out of Jamaica that there was some kind of prison break the other day and a whole bunch of them, like 7 or 8 of them, escaped? And as a result of that, everybody messaging me like, Sandy, can you notify CBC that they're on their way? Make sure they keep an eye out. And I know it sounds very, very, very tongue in cheek, but I can tell you that the chances of them, coming this way is actually pretty high. So CBC needs to be paying attention to the Jamaican news, just in case, because it's like, here they come. Make sure y'all working with the agencies there and sorting the stuff out. Marshall says, I can't believe such nonsense is going on down in Palmdale. I grew up in Palmdale and it was such a nice, peaceful place. So many different people have moved into the area now and it's a hot mess. Well, like any areas, Marshall, it doesn't take much for it to become a hot mess because, even one family moves in with their criminal sons and activity and they can wreak havoc on the entire neighborhood. Nobody is safe. There's no location. I mean, maybe some gated communities feel like they're safe, but you see the robbery at Scotiabank, where are they running? They're running in the bushes right next to South Sound, honey chill. Them South Sounders were like, oh, they come in our nice, prestigious neighborhoods. We don't normally have this type of thing going on in South Sound. I'm like, that's the thing with criminals, honey child. They move all over the place. Doesn't matter. So nobody feels safe. That's why we have to address crime holistically. So Magdalene says, was he adopted by the man that used to have the fruit stall opposite the cricket field? I don't know. I'm going to get some information on that household because I was wondering how she's here. Somebody sent me some information, but to be honest, I haven't had a chance to listen to the voice notes as yet. So it's possible that, she probably married a Caymanian. Maybe the Caymanian adopted her kids. I don't really know. I'll get some clarification on that though, Magdalene. Yeah. All right. Good morning, caller. Welcome to the program.
Oh, hi, Sandra. This is Melanie.
Hi, Melanie. How are you?
Thanks. How are you today?
I'm good. I can barely hear you. Let me try to turn up the volume here. You're coming in a little bit low.
Sorry, I'm in the car.
Oh, yes.
In the traffic. No, just you mentioned earlier about the flooding in Miami.
Yes.
And I just wanted to call in to remind everyone that there is currently a climate change policy out for public review. The closing date for that is 30th of June. It's a really important document, and the Ministry of Sustainability and Climate Resiliency have put that out. One of the prime concerns that I have and a lot of people have wherever you live on this island is that we have a lack of an overall stormwater management plan for this island. And as we continue to develop, we are filling in what is a natural catchment area for our stormwater. So eventually what's going to happen is you just displace that water and it goes elsewhere into people's yards and into people's houses. And we're going to get more, the forecast is, whether you believe in climate change or not, the forecast is we are going to get more and more heavy rain events, which means they're going to happen quickly and suddenly. So all I'm saying is, the policy, if you can read it and support it and give your feedback, if you're in a particular area where you feel that, you need assistance or you need highlighting that your area is fragile, I reckon that, I suggest that people really feedback that, because the ministry are trying really hard to catch up on a lot of lost time to put together hazard prevention for the communities. So I just want to mention that, because Florida is in a mess. They've got a huge mess. They've got a lot more people than us, and they really don't know what to do about it. I mean, they're literally talking about damming Florida and trying to construct dams because they don't know what they're going to do about this. So, so that was me just phoning in on that.
Yes. Well, thank you so much for the reminder, because of course the 30th is literally right around the corner. I'm surprised no one has reached out about coming on the program and talking about this really important policy. It's shocking sometimes the things that get missed. But thank you, Mel. We appreciate it.
Okay. Thanks, Sandra.
I appreciate it, my dear. So thank you. So we have a couple comments coming in. So maybe it's still not too late. We still got another week before the 30th. So perhaps they can come on the program and tell you, the people, more about it. Denver says anyone who breaks any law should be removed from our islands, persona non grata. Exactly. Good morning to Natasha. Moya says, yes, in the US, regardless of family rights, people charged for felony, you're subject to removal of green card, even if it's a permanent green card, and deportation. Siobhan says that CBC needs to pay more attention. Everton says, I don't get it. You leave your country, go to another country for a better opportunity. Why not just play by the rules? Just respect the law. Very simple. I know it sounds relatively simple, Everton, but I think what you end up having happen is that people bring their ways with them. We've had discussions on this show about how culture is transitioned with people. And so people grow up, some people grow up in a culture of violence, of criminality, of dysfunctionality, and that's part of who they are. So for those of us who are law-abiding citizens, well, it sounds very logical that, wow, you go to a new country, you look for good opportunities to just be a good citizen that can contribute, but that's not what they were about in their own country, right? So what do they know about it would be the question. That's just not who they are. And so this is where it becomes important that we sort of filter the people that are coming in. Sounds a bit like we need criteria, but there's nothing wrong with having standards and criteria in place, believe me you. And so, yes, there's some people that should never be able to enter our borders. I don't give two cahoots if it's a work permit or even marrying a Caymanian. Y'all need to start cross-referencing and checking who some of these fool Caymanian women and men are getting married to. And if they have a history of criminality and gang relations, all this kind of stuff, stop them at the border and say, nope, you can't come. Yeah. We can't tell you who to get married to. So if you want to get married to this person, you knock yourself out. You go do that, but you're not going to bring them to reside in this country. You go back to Honduras, Jamaica, America, wherever it is you're bringing the criminals from. You go live with them in their country and y'all make it over there. That's the kind of stance that we should be taking on certain things. Speaking of criminality and the craziness regionally that sometimes happen, we haven't had a good Caribbean connection moment recently, but boy, there's always some madness going on in Jamaica. I gotta tell you, that country is a little bit crazy. You guys saw the sexual assault of a 6-year-old child yesterday that was being reported. It turns my stomach. Absolutely disgusting. A Mason decides to rape a 6-year-old child. For me, that should be an automatic death sentence. You bring the death penalty back for people like that. He does not deserve to live. Okay. They got a cop right now accused of abduction and rape of a 16-year-old girl back in 2019. The verdict in this case is supposed to come in any day now. They say June the 29th. They're expecting the verdict in the home circuit court. A police sergeant, you can imagine? My God, you're not even safe from the police. We had in Honduras, I think Renee is going to be putting up this story. They've had 41 women die in a grisly riot in Honduran prison that the president blames on Mara gangs. So listen to this hot mess. Shocking. I actually had the displeasure of seeing some of the video footage on this of the bodies. Part of the facility is just completely burnt. I mean, it's shocking and unbelievable. But apparently the MS 13 and MS 18, these are big time gangs in Honduras, had some sort of fight in prison. Listen carefully to this, folks. In prison, the prison gangs have control and are fighting for control and so on and so forth, right? So they're in prison fighting each other, and this riot breaks out over the fight. 41 women are now dead in this female prison as a result of that. Some of them were shot, which means that obviously they have guns in prison, which is like, you think about that, you're like, huh? Have it make sense, Sandy? I'm not here to have it make sense. I'm just going to tell you the facts. So some of them were found to have died from gunshot wounds. Like I said, somebody sent me video footage. I cannot show that on air. It is shocking, to say the least, to see the bodies with gunshot wounds and whatever. Some were stabbed. And there was a fire that broke out, and some were literally charred to death. And yes, people are actually sending these videos around. Unbelievable. You go to prison, and then apparently the prison is no better than the outside for these people. My God, absolutely horrendous. So that's happening in Honduras as we speak. That's a bit of breaking news. I can only shake my head because all of these things leave me in a state of disbelief. You know, we need to be extremely careful because we were bringing in MS-13 members here and had no clue. Yeah, y'all remember that? Absolutely no clue that it was happening. They were walking around with their gang tattoos. And then when they got onto the fact that, okay, everybody knows what the tattoos look like, they started to have the tattoos removed before they started traveling outside of their country. Yes, sir. All right. Alejandro says, if you don't have acceptable conduct, it should not be tolerated. It's bad enough when it's our own Caymanians, but at least we know who our own criminals are. But when they tend to just become, just becomes foreigners that doing crime, it cringes me to know they send them back on our roads. Yes, deportation. RD says, ask Melanie if she will be launching a campaign against the huge destruction of 75 acres of mangroves in South Sound from the Enterprise City development. Good morning, caller. Welcome to the program.
Oh, I just kind of tuned in, and I'm just hearing all this bad. That's why I love this little rock. So that's why that incident yesterday morning upset me so, because Caymanians, let us be proud, let us clap, let us stand up, let us salute, let us jump. We are a special breed. Them things don't happen yet. So far, so good. But if we don't stop the mixing and the fixing, and like you said, the marriages are convenient. Because everything is coming, and they got their rights, and they runs to the Constitution, and they pulls that off the shelf, and they flings it at you. And what can you do? And try as best as I can. Number one, just let's nip that in the bud. Look for your own. Especially the man, them.
My dear.
You know, we women, we got our share too, but our men, they can't help themselves.
Yeah.
But I thank you very much for that. Yeah, I was listening about the Honduran thing.
Oh, it's horrible.
I didn't see any footage. I was kind of radioing it out. But I can only imagine. And I mean, that's like the Calypsonians say, yeah, but that happens over them. I mean, I don't think like that's unusual or strange. Maybe not the epic size of it, but then things would happen every day. And we have a good show. It is so sweet. It's so real. So what happened?
My God, what a mess.
Thank you. With the sauce. I know how you ignoring me.
No. We got you.
Yeah,
please.
Thank you.
All right. So, yes, I mean, just absolutely shocking, the situation in Honduras, gaining international coverage now and international news. I just am flabbergasted, to be honest. And I know that, listen, I think our reality, even, we have a scathing report on the condition of our prison. Listen, our prison is like a walk in the park to these people who go to prisons in places like Honduras. You know that show Locked Up Abroad? Is it still on? I haven't seen it in a minute. But I've sat down and watched shows about people in Honduras and different countries, South and Central America, going to prison. And my God, it's unbelievable. It is overcrowded, horrifically overcrowded. It is, the conditions, deplorable is the only way that you can describe the conditions in a Honduran prison. And it's not just Honduras, it's a lot of, South and Central America. It is shocking. Most of these people don't even get a proper facility to take a bath. Yeah. And not only do they not have proper bathing facilities, the gang activity and the criminality in prison is happening just like it is out in the streets. They have access to weapons. You are more likely to probably get killed inside of a prison sometimes than even outside of a prison. That's just how crazy the penal system is in these countries. It's almost like a death sentence. I remember one episode, there was I think he was American or Canadian. Anyway, he was trafficking in drugs and they locked his behind up. And I think it was Honduras, but somewhere in the region. And, he said the only thing that saved him is apparently he played the guitar. So one of the gangs took him under their protectorship because they enjoyed music and he could play music for them. I was like, oh, honey child. But you know what that probably means, right? He's probably also there beyond in prison, servicing them and not just musically servicing them either. I'm like, listen, you got to try and survive those places, honey child. And that's a whole different thing. Garrett says our prisons like the Ritz-Carlton are prisons in the Western Caribbean from what he's heard. Yeah. Our prisoners, remember when they rioted that one time and they were hanging their clothes outside and demanding oxtail and lobster dinner and all kind of foolishness because the previous director at the time, that's what he used to be sneaking in and giving them. And they're like, oh, we need better conditions. We'd like a lobster dinner. We want some stew kunk on a Sunday. I was like, y'all not easy. And I remember when that riot happened, I was here. And I said to myself, Cayman is such a funny place sometimes. Because if this was anywhere else in the world, they would have just they would have gotten the heavy artillery and gone in there, shot a couple of people dead, and taken that prison back by force. But in the Cayman Islands, police officers like, no, not my cousin. Not my cousin right there, standing on the front line, hanging out his underwear on the prison gate. We can't go in there and shoot nobody. You might shoot my family. So, they didn't use any real force to take the prison back. I was like, no, sir. Anywhere else in the world, they would have been like, oh, yeah, y'all want to riot? We're going to show you a riot. Oh, well, that's the Cayman Islands for you. Here's a couple of video clips of what's going on in Honduras. Mr. Amelia is like, what did I miss with Honduras? Girl, you're missing a lot. Here you go. These are the poor women.
Emotions erupt outside a women's prison in the Honduran town of Tamara, Reports that dozens of inmates were killed during a massive riot and fire inside prompted relatives to surround the facility demanding answers, only to be stonewalled by authorities.
They haven't told us anything. We've been waiting to hear what happened inside. I don't know if my cousin is alive. I just don't know.
We want to know who is alive. They're human beings. They're our family. We want to see them and know if they're okay. We want answers. We're in pain. They could be dead already and we don't know anything.
According to reports, a brawl had broken out between rival gangs in the early hours of Tuesday morning. Investigators say most of those killed were burned to death, with the remainder either shot or stabbed. 7 women were rushed to hospital with gunshot and knife wounds as authorities worked to identify the mass of bodies.
They're not providing us with any information. Until forensic experts come, they won't be able to tell us anything. But we're still here.
Earlier this year, the Honduran government formed a commission aiming to retake control of prisons run by gangs and crooked officials. The Honduran president insists inmates had planned the riot with the knowledge of guards and promised drastic action as a result.
The Honduran people must know we will not allow any efforts against organised crime to be sabotaged. Organised crime has hijacked our country's penitentiary system. It's trying to cause fear and failure among authorities, but we will not give in.
A government declaring war on gangs driven by power, the makings of an even more volatile environment for prisoners and their families. Manny Tsigas, ABC News.
Authorities say gang members entered a section of this women's prison where rival gang members were held. Then inmates were shot and others were burnt in the facility located in Tamara, north of Honduras's capital. Angry relatives want answers after at least 41 people were killed. They say they haven't been told if their loved ones are among the dead.
We are practically demanding that they tell us what is going on. As relatives, we are here with uncertainty. We need a list of the people that are alive because we cannot get a list of the dead until the forensic experts come and we cannot get information from them. But while we are here dying of pain, of anguish, brothers and sisters, we definitely don't have any information.
Human Rights Watch says there are an estimated 40,000 members belonging to MS-13 or Barrio 18 gangs in Honduras. The government launched a crackdown in November last year to try and eliminate gangs which control and extort swathes of territory. The Deputy Security Minister says the prison riot is an attempt to stall the government's progress.
The Honduran people must know that we will not allow, under any circumstances, the attack or sabotage of the actions directed against organised crime and the organised criminality that has hijacked the penitentiary system of this country.
There's a history of prison violence in Honduras. 18 inmates died in a fight in 2019, and more than 350 others died in a fire in 2012. Here at Tamara, more than 20 children also live in the prison.
Oh my God.
Prison officers are trying to find out if their mothers survived the violence. Barbara Angopa, Al Jazeera.
A riot at a women's prison in Honduras left at least 41 females dead. The authorities are now working to identify the victims. At the 900-person women's prison in Tamara, around 20 kilometers from the Honduran capital, most victims were burnt. There are also reports of inmates being shot at.
Unbelievable. Wow. Such a sad situation.
The prisoners belonging to the feared Barrio 18 gang reportedly burst into a cell block and shot the inmates or set them on fire. The officials say that at least 7 female inmates are being treated at a hospital for gunshots and knife wounds.
My God.
As per the police officials, the forensic vehicles arrived. The desperate relatives of the inmates gathered outside the prison looking for answers.
And of course, Honduran president has said she's going to take swift action.
We want to know who are alive because they're human beings. They are family. We want to see them and know how they are feeling if all of them are quiet. What are we doing here? Staying silent as well? No, we want answers. We just want one answer and to have them out and not have them sleeping there because they're not their family, but ours. Feel the pain, as you can see. Maybe they're dead already and we don't know anything.
Condemning the prison riot, the Honduran president said that she would ensure that drastic measures against the accused take place.
Well, folks,
The Honduran people must know that we will not allow under any circumstances the attack or sabotage against the actions towards and directed against organized crime, the organized criminality that has hijacked the penitentiary system of this country.
The riot appears to be the worst tragedy at a female detention center in Central America since 2017. Back then, girls at a shelter for troubled youths in Guatemala set fire to the mattresses to protest rapes and other mistreatment at the badly overcrowded institution. The ensuing smoke and fire killed 41 girls. Earlier, Honduras witnessed a prison mishap in 2012. That is when over 360 inmates died in a fire.
So, folks, again, that's the current situation in Honduras. It's a developing story. I'm sure in the next couple of days, we'll probably have a final number, but they're saying at least 41 women inmates have either been shot, stabbed, or burned to death. You know what was so sad for me is when they talked about the fact that in these prisons, women get pregnant. Sometimes they're sexually assaulted, they're raped. They might have some degree of consensual relationships with men, but a lot of times it isn't. And then they were sentenced to jail whilst being pregnant, and they have their children in jail. And the children, isn't this shocking? Children, babies stay in prison with their mothers in these types of deplorable conditions. I mean, it's hard to imagine a child being born in a prison and actually remaining there as though there's no loved one, there's no family, there's no one that can actually take that child and give it a better life outside of a prison. So, of course, one of the concerns now is of the women who have been murdered. They don't actually know, if that's impacting those who were there with children. Just quite a horrific situation, to be honest. Shocking, to say the least. So we're sorry to hear about this. Again, violence in these prisons is nothing new, unfortunately. But, this is still quite a shocking indictment on their systems. We can't take an attitude that we don't care what happens in other people's countries, because unfortunately, there's always a trickle-down effect. We live in this global community, in this global world, where something happening over Yaso impacts us, So when I talked about earlier this morning, the fact that we had these, people escape this prison in Jamaica, I know y'all thinking, well, why do I care about that? That has nothing to do with me. You better care, because they're going to be in the next illegal ganja boat straight to the Cayman Islands. So that is why it is important that we are informed and we understand how the world is connected. You can't run away from these things. You try to put as much in place as you can in terms of border control and protection. I think that we need to do a lot more than what we're doing, but you certainly want to be aware at the very minimum of what's happening around you. Such a just sad and unbelievable situation. All right. Damien says the drug trade that ends up in the US and Europe. RD Limited says the problem in Cayman is simple. The business people get what they want. If it's cheap labor they want, they get it. Government only cares about the average person months before the election. I don't think it's as simple as that, RD Limited, because I'll be quite honest with you. A lot of the people who are bringing in these undesirable people are not business people at all. It's the average Caymanian who is either looking to make a quick buck and use someone, or sometimes, the average Caymanian falls in love with a criminal from Honduras and other places. And then they want to turn them into a princess when in fact that's not what they are. They're gang members and so on. Here's the stark reality. Y'all need to pay attention now. Remember the young man, and my condolences to the Brooks family, who committed suicide. This was back in, oh gosh, I want to say maybe 2019. Give me a second now. I'm going to do a little search on CMR's website. So this young man committed suicide. He had found this Honduran woman that he was dating, ended up marrying her, and it turns out to have been the worst mistake of his life. She was a criminal, gang member, came here pretending to be some kind of hot sauce, finagled him. Poor kid, he wasn't ready for that level of, ready for that level of trauma. Didn't know she, was capable of doing some of the things that she could do. And she literally, the allegations are that she literally sent this young man crazy. I'm looking for the story. I soon find the story for y'all. You just hold on a second here. Even came here with fake papers. She was married before. And then she found some other Cayman, and she actually committed bigamy. She found some other Cayman to go jump on and got married to him. I'm telling you, our people will perish and die because of lack of information and knowledge. Yes, she was here amongst us. See, here it is, 2018, March of 2018. My goodness, time really, really flies. And this is, again, this young Eric Matthew Brooks. Condolences to his family. And it says in the past 24 hours, since he was found unresponsive at his mother's home in Frank Sound, an outpouring of love and support has flooded social media in response to the untimely passing of the 28-year-old immigration officer. Young man had his entire future ahead of him, and he starts dealing with this Honduran woman, and she was like, a snake in the grass. And folks, unfortunately, caused this young man's death through her antics. She was doing all sorts of stuff to torture him. If you don't, recall this story, you can go and have a read of it, right? She had assaulted him before. See this picture of him here? Back in January of that year, she had attacked him with a bottle. He was refusing to bring her multiple children here from Honduras. So you get caught up with these people. You don't really know what their history is. And that resulted in him being assaulted while attempting to fill up his car at a local gas station. Poor kid. He didn't know what he was in for. Right? Come to find out, look at this. She actually had a fake marriage certificate. Y'all got to go read this story. She was already married to somebody else. Of course, didn't tell him that. I mean, this story was just unbelievably shocking what this woman was involved in. And again, the streets were talking that she was involved in gang activities in Honduras. So y'all think you know what's going on when the pretty little things come here and they put on a half naked outfit and walk around, y'all impressed. Like, oh, they so pretty and look at this and that. Yeah. Mm-hmm. There's a reason why a lot of them are running from whence they come. Come in. Mm-hmm. Yes, honey child. She was involved in quite a mess. And you know what is so interesting? Years later, after this, she was actually detained in Honduras. Let me try and see if I can find that story. Where she was arrested for, again, being involved in one of the Honduran gangs. What was her name again? Kenya Yadira Alonso Solis from La Ceiba. Mm-hmm. Yeah, she was like a black widow. Uh-huh. So she was charged with GBH. I don't recall if they ever charged her with the bigamy, but they were trying to get rid of her, I think, as quickly as possible. So eventually they deported her. But there was a story then that showed up sometime afterwards when she returned to Honduras that she was actually caught up in some gang activity. See, here we go. December of 2019. I knew the story was there. Look, yeah. Standing up next to the armed units in Honduras. There she is. Made headlines back in 2018 when she was arrested and charged with bigamy in the Cayman Islands. They did charge her. She's now been arrested in La Ceiba, Honduras by the National Anti-Mara, that's anti-gang, gang force for allegedly being a gang member. And this is the pretty little thing that had come to the Cayman Islands, and you look, Caymanian boys are falling all over, head over heels for her. Wow. Unbelievable. Good morning, caller.
Morning.
How are you?
So not bad. So you telling me that some Caymanians are kissing toads instead of princes?
Most definitely. Mm-hmm.
Oh my Lord.
Yeah.
We have a serious problem though, because some people can't seem to understand the connection between their actions and the crime that's occurring.
Yeah. And you see this MS, we're talking about this MS-18 earlier, right? Members of the 18 gang in Las Mercedes, La Ceiba. This is the same gang now that is involved in this riot in the prison.
Yeah. But here's what bothers me, right?
Mm-hmm.
The level of which we have crime at the moment it's just bad from Cayman standards, but it's not bad when you think about it compared to other places.
Mm-hmm.
But what really concerns me is if we're not willing to do something about it at this level, if we find ourselves in the very near future having to deal with gangs like those coming from Honduras and other places, we're most definitely not going to have the courage to deal with that.
Mm-hmm.
And you know, I haven't brought this subject up in a little while, but usually what people do who are cowards is they will come to people like me and say, well, I think you should give up your lawfully owned firearm because that would make us safer.
Mm-hmm.
Well, I'm going to have news for you. It's not going to go like that. All right. And I recommend to the public that we deal with this before it gets completely out of hand. All right. This is serious. You're not going to come to me and tell me to give up my lawfully owned firearm because you feel unsafe. Okay. That's not an option. Okay. And so you're not going to be able to deal with this level of criminality by words. These people don't negotiate. They use violence as their means of propagating their lifestyle. Okay? And by the way, the person who ran that attempted robber down recently
needs a yes.
Thank you. Yeah, thank you. I appreciate you caring enough about your society to send the message that the business of crime is going to be taxed, and sometimes that will mean they'll be taxed to death. Okay? Because what we are doing is we're sending the wrong messages in, and unfortunately, the police department is playing a serious role in this. They're telling the public, oh, just leave it to them. Well, I wouldn't mind leaving it to them if they were actually effective in apprehending these people. Okay? But the truth of the matter is that the police are not first responders. The people who are at the scene of the crime are the first responders. Right? And in many instances, that is where the crime will be put to stop, halted for that particular instance, or it won't be. And it depends on your mindset about what you're going to tolerate in your society. You remember when, I think it was Derek Baines, David Baines, I think it was, ran that guy, crushed him with the car. And there were people who were like, oh, da, 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 da. Listen, if you go out and even if you have an imitation firearm and you misuse that
Yes.
in the commission of a crime, do not believe that because it is an imitation firearm, that somehow you're going to get a lesser sentence if you're caught. Because legally speaking, while it is lawful to own an imitation firearm in and of itself, it's a criminal offense to misuse that imitation firearm in the commission of some other crime. In that instance, it's treated as if it was a real firearm because it's very difficult for the average person to be able to determine whether it's real or not. And the fear that you put people through will change their lives forever.
Yes.
The psychological help that people will need, and think about that. If that continues to happen over and over, how many people in society will have to be traumatized, perhaps for the rest of their lives? Some people will get past it, but some people won't. And to what level of this are we willing to tolerate? If you are a parent of someone who commits crime and you know that the person commits crime, my recommendation to you is that you try to talk some sense into them to change their lifestyle.
Yes.
Because if you come over to my place, okay, and you believe that you're going to walk in and do whatever you feel like doing, it's not going to go that way. You've been notified. Okay, that's the only public notice I can give you. It will not go that way. Right? Okay. Because I refuse to sit down and allow this kind of nonsense to happen. All right? So do not keep your mouth shut. Do not let crime get out of control. Because you may find yourself crying over your child who has lost their life in the commission of crime because you as a parent said nothing about it.
All right, caller. Thanks very much. Appreciate it.
Take care.
All right. 936 Bobo is the telephone number. If you have a question or comment, you can certainly feel free to call into the program. Some very strong words there from Denny Warren Jr. And of course, we know that in terms of criminality, complacency or direct involvement by family members continues to be a real problem. Last week, we were talking, what day was that last week with Garfield Robb? We see how his wife is not only complacent in his actions, but his wife is actually assisting him by allowing him she takes out a business license for him and also allowing him to put the proceeds of this money into his bank account. This is why I say, where are the people at Butterfield Bank? Butterfield Bank has a reputation for not wanting to give certain people a bank account. This is the time now that they need to close that bank account for that wife. Because this is potentially proceeds of criminal conduct. Why is she accepting money on behalf of her husband, who has a long history of doing this sort of thing, and is in court right now for 13 charges of the exact same behavior? Ms. Brenda says a lot of them come here with fake papers, even their so-called marriage certificates that allows them to remain in her country. Disgusting. Couple $100. This is what somebody said to me. Let me tell you this one. What this person said a couple days ago. It was very, very interesting. She said, too many criminals are here. This was Friday's show. Too many criminals are here from Jamaica, 10,000 Jamaican dollars, and you can get a clean police record in less than a week. Make that sink in. Then expressive work permit. They're coming in, boy. Immigration needs to step it up. The $75 licensing fee is out of control. Now, the irony of that is the $75 licensing fee was meant to be beneficial to Caymanians. However, when you have in the group of Caymanians, meaning everybody, that has the right to be a Caymanian. And Caymanians, like multi-generational Caymanians, sometimes are part of the problem as well. Right? Because they're taking out work permits for people who they have no real employment for. And they're allowing criminals to come here with no way to survive, to pay their bills. So what do you think some of them are going to resort to? Damien says you can't judge everyone nationality by the bad ones. They have good and bad everywhere. Of course they do. But I'm telling you, there's a difference between having bad in your own country and then turn around on top of that, compounding the situation by importing bad. And you don't even know what you're importing. You don't know how bad it is. This girl's a damn gang member, MS-18, right? Y'all see her there in that arrest picture with armed gangs. I don't know what prison they sent her to, but I'm sure she's gone to prison for a really long time. And as a result of her coming to this country and, wreaking havoc on the life of this poor little Caymanian fella, she wasn't much older than him, but let's just say that she had a world of experience on top of him. He didn't know what hit him. He wasn't ready for that kind of situation. Good morning, caller.
Oh, gosh. Who, Damien? Poor Damien. I don't know who Damien is. Damien, we are talking, trying to say people like you seem to be naive with these nice little words. Listen to me, man. Mm-hmm. We talking about people who done did. You remember the young boy that you were talking about?
Mm-hmm.
You know where his mother come off of?
Mm-hmm.
Right out there by Airbody, Mirror Street.
Mm-hmm.
Gone too soon.
Yeah.
Damien, if you can't help us, Damien sounds like a man's name. If you can't help, if men in this country can't help, like Miss Sandra would say, go to the back of the class, make the woman take care. We used to that. Now let me go down in the history book. Now we used to that, and came and need to clean up. And because I want to clean up. You young and is out there thinking and I can't die and I'm not gonna die. It ain't nothing like that. Go to the back of the class, sit down and listen. And if we need man strength, then we gonna call you. But we dealing with the intellectual part of it, So if we need something move from spot to spot, place to place, we calling you because you're not thinking right. But good and bad everywhere. Let us talk about the human condition then, since you want to get crafty with your words. Anyway, Damien, have a nice day.
Lord Jesus. Yes, folks. I mean, that goes without saying that there's good and bad everywhere. What I'm concerned about, I'm not concerned about the good that we're bringing here. I'm concerned about the bad that we're importing because that's where the problem lies. And like I said, we're importing it at all fronts. Some are coming here by way of the work permit regime not being all that, strict. Some are coming here marrying Caymanians that are simple men and women who don't see what it is that they're getting into and don't take the time to do their due diligence and find out who these people are, right? Y'all need to start learning how to do some background checks on some of these people, but you fall in love so easy and you get a little woman squeezing you up. Next thing you know, you're ready to make her a wife. I mean, I'm always shocked at how quickly some of these relationships, I'm like, you met these people family? Have you gone to Honduras to see where they're from? Because when you see the hole in the wall that some people crawl out of, you might pause and think twice. Like this is what, and then all of a sudden they got spring on you and tell you about children that you didn't even know that they had. Husband that she was already married and charged with bigamy. He did not know that she was married. Good morning, caller.
Yes, on there. Here, everybody get in touch on the Spanish part.
It don't have nothing to do with Spanish. She could be a Jamaican. She could be American. It just so happens in this particular case, she was from Honduras.
Yeah, you know, getting involved with a gang member, that's a serious commitment, a relationship that where that you're gonna put yourself in a position where it could be life and death.
But the thing about it, he obviously did not know that. This is the danger of getting involved with people that you don't know anything about.
So here's the thing with that part, right? It's where you meet these people, because majority of the times you can only meet these people in certain locations, and you can't just go and walk in the supermarket and go and say, "Hey, mommy, you look good," and then they just fall in love with you like that. It doesn't work that way most of the time with these gang members. So I don't know the backstory in between.
Yeah,
what
some of them
thought
be up in church pretending to. I know one up East End.
Well,
that fool came in and he went and married her real quick. You know, he said, "Oh yeah, she was a WHORE on wheels when she first came here, but now she's a Christian and she goes to church with me and she wants to make a life here." I said, "Knock yourself out, son. Knock yourself out."
Yeah, you know that the hospitality with Spanish women is very, very good. I gotta say, when it comes into parents. And,
what do you mean by hospitality?
I don't know, like, I gotta say this, like, you know how people have good behavior amongst others, like strangers, and then they come into an island where they don't know anybody, so everybody is a stranger.
Okay.
You know, like, I just saying, like, okay, if you is in a relationship with a Spanish person, say for example, this Honduran girl we talking about now, anything is going to provoke her, even if it was the fact that she didn't get that pasta that she wanted from Casanovas. You get what I mean? Like flip. They can just flip. Talk about mental breakdown. Yeah. They go crazy. And I'm not saying this and just to bash every Spanish girl, because not every one of them is like that. But you see the ones that are raised with a certain mentality about loyalty and all this type of foolishness. Then that's where it gets triggering with some of them, that gang type of thing. It just boils inside of their blood. And I guess that's all Spanish people, I mean, because they grew up with some traumatizing situation when they were young, right? Yeah. I mean, it's the environment. It's the environment. Some people, okay, like how is mental health month for men? Some people think that mental health is a chemical imbalance in your body. That is just the environment where we grew up in what's causing mental health. Some people think that, oh yeah, they got you know, like anxiety and depression, but really and truly, how your life is. Your life good or your life bad? You know? So that the same thing goes with these relationships with the Spanish people. If you like how they treat you, I guess work with them, and then afterwards you can, you know, cross a little deal if you come with a disagreement or something like that. But you check out majority of the women that kill man up in Cayman, they're Spaniards.
Okay.
Yeah, I mean, just think about it, man. We got to wonder if we're taking these relationships pretty serious, because boy, marrying left, right, and center, we don't know who we marrying.
All right. Well, think about it. Thank you very much, caller. You know, I don't know, folks. I mean, sometimes my head gets a little bit woosah. Listen, we've talked about this concept, and it's not just a concept or a construct, it is reality of importing a way of living that changes your culture. So you import people with a violent mentality, right? That's just how they grow up. Listen, there are people elsewhere in the world that are forced raped sexually by the time they're 12, 13 years old. All they have to offer is their bodies. And whether or not they become gang members or whatever, these women have a role to play in their communities, right? And, you know, as part of, unfortunately, the context of how they are dragged up in this world. Not everyone comes from a good, stable home and a good, stable environment. My thing is, you just need to know where people are coming from. And it doesn't mean just because someone is coming from chaos and destruction that they will remain in chaos and destruction, because otherwise there'd be no such thing called hope. There's always hope for change. But you've got to really understand and ensure that you're not just being, you know, living in a fairy tale world, that you're being realistic about whether or not someone has really changed from their circumstances that they were born into and that they grew up in, and that would have impacted their lives in a very, very meaningful way developmentally for many, many years. Can a tiger change its stripes? That's a age-old question. Some people can and some people cannot. And you just have to know what it is that you're dealing with. And one of the things that you have to do is don't move so fast. anytime you see a woman or a man wanting to move very, very quickly in a relationship, you better ask yourself the question, why? Denny, you got another comment or question?
Yeah, someone asked me to elaborate on one aspect of of what I was talking about, which is more legal. And it has to do with, we think about the right of self-defense, and that's a general concept that, by whatever means that you legally possess something, you're able to defend yourself by it. But under Cayman law, it goes a little bit farther than that. In section 18(1)(a) of the firearms law, it says, no person shall discharge any firearm within 40 yards of any public road or in a public place, except in the lawful protection of his person or property, or the person or property of some other person. So it's explicit in statute. Okay. Where I criticize the RCIPS in some instances in relation to this is that they very deliberately mislead the public into believing that you can't have a firearm for personal protection. And on top of that, if you say that you are a business owner and you want a firearm for your protection, they try to say, oh, no, you can't do that. Well, you told me that you don't remember Comart that well. Well, the man who used to own Comart was Mr. Wilco. And it's not one occasion that I went to his store and saw him in his office with his revolver in a holster on his side. Okay. And the reason why that is possible is because the law allows that to happen, even in the context of a business. If you look on form, if you look on the application form in the regulation, you will see that it talks about having it, like where would you keep it in a place in either in your home or business. Well, if it wasn't intended to be used in a business, why would Cabinet prescribe a regulation that asks you a question in relation to a business? Right? And so what I'm trying to say here is this, is that in a lot of instances where people would be at risk would be people who are perceived to be business owners or may have valuables that doesn't have to necessarily be cash. It could be other values that people would come under attack for the purposes of finance, robbers looking for valuable things. If you're not able to defend yourself, okay, and you are the person who will have to survive the attack, and the people who are coming for you are armed with firearms, you're at a severe disadvantage. Okay? What that will lead to is a society in which people will be at the mercy of criminals because they will be essentially defenseless in that context. There are those who say things like, oh, learn martial arts. I don't object to people wanting to learn martial arts. If you're in close proximity of someone, let's say they're 10 feet, martial arts is probably a good thing for you to have. But if the distance is more than that and the people are armed, especially if there are multiple people, the martial arts is going to be very limited in its benefit to you.
All right, Benny.
And well, just let me finish this thought here. So we have the police who are trying to make the people believe that something that is clearly written in the law isn't permissible. Okay? And I know that there are people who would like to use firearms for their protection, but they're being misled by the public, by the police. The commissioner of police is under the impression that he can do whatever he feels like doing. The problem I have with that argument is that the provision that says he has absolute discretion begins by limiting the discretion, limiting it to the application process. And the application process is where this provision is that I'm talking about in relation to businesses, that he is saying he has the power to override. Now, if the provision says subject to Section 20, then it means your power is limited by Section 20. And Section 20 is the provision that allows, which is the application process, that allows it to be for the purposes of businesses.
Thank you very much.
So I'll leave it there.
Thank you. Appreciate it. Another caller on the line, waiting patiently. Good morning, caller. Welcome to the program.
Hello. Good morning. On the subject, the top, sorry, for a minute. I always wonder, we have some of the older, retired, but very body able and mentally able police officers, customs officers that, has done their time, but is now retired. What about government bringing it? Because we had some of the best in those 80s times and stuff when came on. We had very good police officers, custom officers that they did their job without a wink, and people had trust in them and also fear in them. So I always think, like, why don't the government put it? Because I think what's ruining our force and right out is it's just too many officers that we do not know and that they don't know us as a nation. So if we could build some, I don't know, like a retired force or something. These are just things that I be thinking about because I can remember you getting information, so and so, because they had trust in these officers and they didn't make no joke. They went in, they took care of business, and if they got locked up, they got locked up or whatever the case. So I know that there's still officers out there that are physically, mentally able to do some type of, I don't know, organization. I don't know, maybe some would even volunteer. But like what Danny said earlier, we have to do something about this. This it scares me to see how close we are to these criminals and that are amongst us and almost out of control. When they get up to that point, there's no return. God forbid, there's no return. So, we, and again, as a family, as a country, we should really think twice of what we're getting into and give the police that you trust. I'm not saying you got to trust all of them, but those that we trust, thank God we got a head of the police is a new commissioner who's a Caymanian. I'm really hoping and praying that those Caymanian officers in authority will get down to the roots of things and get the work done, because they don't have nothing to be scared of. And I think the public will be very supportive of them if they just go out. For example, I know some of those officers that gone straight from school to the police. I think the new commissioner to be is also one of them that never had another job besides in the police force. And what I would love to see is those same officers go into the high schools, going to the school from sixth grade, from grade 6, where they're going into a bigger environment or older environment, John Gray, whatever it is, and tell them, show them examples. Brad, for one, I always talk about Brad because Brad has been in the force from he left school, I'm sure. And the same thing with the commissioner. And there's a few other officers, I can't remember the names now. But go in there and show the young men and women, hey, this is a good job. We need you. Start to recruit and groom and get those kids into service. You know, the service is there. We need you all. Work with them, and I think it would change the whole landscape of how Caymanian young people are thinking about police. Because right now, when you say they say, "Oh, me, not me, I ain't going in there," because they don't have anything or anyone, to say encourage to look up to. These are fine men that are in these positions now and women that they can, I look at Wendy Parchment, I think about her too, has always been in the force and doing an excellent job, but it needs more than a handful.
Yep. All right, caller.
To take our force over.
Thank you. Really appreciate it. 936 Bobo is the telephone number, folks. So it looks like Bret still monitoring the storm. Still some days away, but they're saying that it should not pose any threat to us. Of course, I think it's probably a little bit too early to say that at this particular time. But we'll continue to keep an eye on that situation there. Some good points by the last caller. I think there's absolutely nothing wrong with, putting, even mentorship programs in place, not just police, but immigrations, customs. There could be so much that could be done in our schools from, elementary all the way up, encouraging our young people to be more involved in understanding how these services work. And just involved in being really, really good citizens as well. We've got another caller. Good morning, caller. Welcome to the program.
Yeah, I can't agree no more with that last caller, because let me put my little 2 cents into it as well, because officers like Mr. Bret and PC Harvey and Steve Myers and Adrian Nebelet, these good officers out there that would encourage Caymanians to try to stay in their place, try to stay out of trouble, encourage us to not do bad and just do all the good stuff. And there's other ways of dealing with conflict, especially, and drugs, substance abuse, and all these things. They don't teach these things in school anymore, I don't believe. We used to have the DARE program. Where's that gone? I don't know if that's still running around. And now they're saying that they don't even want to teach sex education, and we have a lot of pregnant women going around the place now, coming out of school, or call them women. But we have a problem with crime on this island, and there's too much foreign officers. Like what Mr. Steve Markfield said, that they don't trust us Caymanians. Now, if a Caymanian like me, for say example, I want to serve a little duty on my island, and I want to go and say, put myself in the fire service, because I don't really believe too much in the police service unless, you really focus on crime. You want to deal with crime, that's on you, But when you have a Caymanian that is encouraged to do something, and they push them away because maybe they might be able to hire a person 10 years older than them that might have more experience, and you don't have to train them, and lazy ass people on this island that we got here to call government civil servants, because they would prefer to hire a foreigner already that doesn't have the experience and train a Caymanian the way how they're supposed to be trained. You see, teaching us Caymanians to serve our people and serve our country is a duty that we have to sign up for. Yes. You think that you're going to hire a Jamaican to have a duty on this island to respect our people? They won't respect themselves. They don't even want to respect themselves, actually. Because if they did, they would have done a good job. But a lot of them in the police force, they get involved in a lot of the, what you call them, white collar deals. And these people that are paid out, a lot of them sell out as well. A lot of them a bunch of crooks, drug dealers, and a lot of them have everything under their fingernails. They can literally clip you off if they want. Yeah, and then they call it wash money. These people that have these businesses under other people's name, if you want to be a good entrepreneur, you have to have someone co-signing for you, right? As a drug dealer, that's how people run them things as well.
Okay, caller.
Yeah, so learn from the mafias that you see up in Russia.
Thanks
they call
very much.
themselves Russian.
I appreciate it. All right, folks. Starting to wind down a little bit here this morning. What What a hot mess. Yes, sir. Mm-hmm. Well, honey child. Mornings, I am a little bit speechless. Okay. I was actually looking at something. We're going to talk about this one day. Today kind of gotten away from us in terms of a discussion, but there was something I saw come across my email earlier about test results out of Miami for education. Let's just say that we're on the same boat, it appears. Caller, good morning.
Yeah, you're trying to wind down, but we're just getting started.
Lord Jesus.
Miss Darlene, I hope I'm getting her name correct. She's in the UK.
Darlene Manzanares.
Yeah.
Mhm.
She raised a very good point about getting Caymanians in the police force. I
Mhm.
think that's a very, very important thing. But what we need to ensure is that we have people who are well-rounded
Mhm.
and understand the importance of integrity, because no matter what system you put in place, it's not going to work if the individual don't understand the importance of themselves,
Mhm.
holding themselves to a higher standard, because the weakest link is the individual. And so we desperately need that. That is an awesome point. We're not going to see ourselves improve unless we do something about the police force in terms of Caymanizing it. I don't mean Caymanizing it by importing people and giving them status.
Mhm.
It has to be about the integrity of individuals.
Mhm.
And that's going to play an important role. But one of the other points that she made was that there were officers of the past who were respected. Okay.
Right.
Well, that's important. But the element that we're talking about today is people who are involved in gangs that are hardened to a degree.
Mhm.
That we're not talking about integrity anymore.
Mhm.
We're just talking about just hardened criminality. Okay. And so while the point that she's making about the integrity of officers is an extremely valid one, it doesn't cover all of the scenarios. And so this is why what you're talking about was about who's able to come to the country, what kind of background checks are taking place, what our immigration policies are, about how society are also very, very important. And I would encourage the Commissioner of Police to Caymanize the police force with people of integrity and hold them to a high standard, so that we can get a grip on crime, because people need to be able to trust police officers, not the level of distrust that currently takes place.
Thank you, caller. We've got two other callers on the line. Good morning, caller. Let me see who came in next. Next was 1811. Good morning, caller.
Good morning.
Morning.
This is a very sticky subject to me. For those who don't know me, which I think would be very few by now, my father was the very first deputy commissioner of these islands. And prior to that, he was always the most senior ranking Cayman police officer, even though he wasn't a born Caymanian. And he came here, and that's where he ended up. And one of his main policies was, you're hiring Caymanians. You're going to train them. This is Caymanians know Caymanian, and we will get better respect and cooperation if they are Caymanian. That is the way he ran the force, and that's the way it was run until he was gone. And I can say, and I would dare anyone to disagree with me, At that time, we had a good police force. There wasn't everybody from everywhere that we didn't know, because that was one of his biggest fears. And we now have what we have today, another police force. It's just like our country. It's going to hell in a hot basket. Because there are no Caymanians there anymore, except one or two, and they are really not wanted. They refuse to promote them. The main thing is to force them out. They have this system that if they haven't been promoted up to, I think they call it a gazetted right, they have to retire at age 55. That is crazy. Some of these officers, even if they weren't promoted up to that level, you don't have to retire them and force them out at 55. Why don't you then put them in the training school or give them a desk job if you can't do it anymore? It would have the same influence. No, they have to be the authority because they want their own time in. People work better with their own time.
I think we're getting a little bit of feedback. I don't know if that's coming in from the other caller, but I just want to remind people if they're on the line
I think it is.
Yes, to be mindful of the feedback. Yeah. I think we got the gist of what you said though. Thank you so much, caller.
Okay.
I really appreciate it. All right. So just remember, folks, that sometimes what we'll do is we'll actually we will answer more than one call and we'll put you on hold, but you've got to be mindful of your background noises and that sort of thing, because it can definitely impact what other people are hearing. So, okay. A couple more minutes, about 5 minutes left in the program. 936-2626. Just trying to wrap up a few things here. Let's get an update on Tropical Storm Bret. Good morning, caller.
Yes, ma'am. Good morning again.
Morning.
Following Mr. DW down the lane, speaking of humanizing the police, quote unquote, service. I believe if we begin to rectify that from the psychology service, we grew up knowing a force. Anyway, you don't just need to humanize the police service. I'm talking about the judiciary. We need judges, Caymanian judges on the bench. I've been hollering and screaming about that like forever. We don't have any judges on the bench. This whole thing about people coming here on the plane and seeking out their bird's eye view of where they want to go because they see how they can get where they want to go in life. And the country suffers. We don't have how many Caymanian judges we have? The law school is there. People pass through. I don't know if it's adequate or not, but it's what you give us. So the standards got to be at least to our standards locally. You mean we can't find any judges? We don't have any, and middle management to the wider private sector. People at mid management controls a business. I went to a good American school. Maybe they don't teach you that in the English thing. But by 14, you doggone well know that. People at mid management controls any business. They don't even have to be smart about it. They just apply the standards, the rules, the policies. Everything in Cayman is set against the average Caymanian advancing to have a say, to be able to do some little constructing themselves, since the broader administrations, whether it's government or private sector, don't seem to understand the benefit of, and the country is punishing. And I'm speaking to politicians, elections soon come around. People who vote like myself, we want judges, our own judges, and mid-management should reflect that this is the Cayman Islands where we are residing. It shouldn't be a hodgepodge of Tom, Dick, Harry, John. And if you got a Caymanian in the business, they sleep in the floor. No matter what they try to do, they can't raise up because that middle management, for their own protection, is not going to ever have a favorable evaluation of them. Your hair wasn't part at the place where we say you should part it, so you're not going no way. And that's how the broader Cayman. And as for the service know what they're doing. They're called cops. They exactly know what they're doing to close the door. And that's not to say that we don't have good police officers from abroad, because I know 2 of them. 3 actually, excellent people. But we need more of our own. And we need to know what the process is and the policies to get where we want to do. And every administration come in this country, they spend their 4 years and they're gone. And if you not put the stop blocks in the way and the step ups in the way, Caymanians are never going to be better off. This country is never going to be better off. Everybody just wind and they go or they stay. And, you know, it's another 4 years of winding and winding. And me, for one, I'm just sick and tired of it. Doggone sick and tired, too.
Thank you, caller.
Even the judges. Thank you, ma'am.
I appreciate it. So we're having a call, Mr. Amelia says, to bring back people who are well past their prime. Marlon Bodden, Henry McField, Ron McLean, Velma Hewitt, Powery Hewitt. The problem with that, folks, is why are we, I get what Miss Darlene was saying, that they could still be of some use, but surely they're not the only good cops that Cayman has ever seen. Why are we bringing people like in their 60s and 70s? Does that mean that we've had no succession planning over the years? We don't have any young and up and coming Caymanians who can work in the police force and have had adequate training and can actually do a good job? We've got to bring back people from 30, 40, 50 years ago? I'm not so sure that makes any sense. And let's be very clear. They may have been good cops for a number of different reasons, but one of the underlying things that everybody seems to be missing this morning is a lot has changed in the world of criminality. What criminals used to do 25, 30, 40, 50 years ago is not what they're doing in this day and age. So the very techniques that the police have to use to get a hold of the criminal enterprise is very different. We've already imported criminals from elsewhere. And so we need to understand, that's what I was talking about earlier, we need to understand things about these gangs and where they're coming from and how they operate. Because if we're operating by Cayman standards or Caymanian standards, we're always going to be lost and we'll never get any further ahead. This is a much deeper conversation, folks. We've only scratched the top this morning. Continue to tune in to Cayman's number one talk show as we continue this conversation. You guys have a fantastic day. We'll be back tomorrow morning. Make sure you tune in early.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's number one talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.